Hey everybody, if anyone's tuned in, you should be able to chat with me. I'm trying out this right now. I'm broadcasting to Twitter and Facebook and YouTube at the same time. So theoretically, if you're on any of those platforms and you click on whatever you see me, if you're here, you should be able to chat with me by typing on your phone, on your PC. I'm guessing on the PC it works better. But if you're watching on Twitter, then you go to Periscope. Oh, there I am. All right, I'm going to see if I can get into Periscope here. So you click on the image in Twitter if you're watching this on Twitter, and then theoretically it opens up Periscope and brings me up there. Okay, so 3 people are watching. Hi, guys. If anybody is watching and can comment, knows how to comment here, if you're watching this in the Periscope window or you have the Periscope app and you're watching it on Twitter, there you go. Oh, okay, good. Kathy, can you hear me okay? Kim, hi, Kim. Somebody let me know if you can hear me okay. This protest is taking place in Olympia, Washington. This is the Q13 feed, a station that I used to work at about 1,000 years ago. I used to do the Kids Club programming there. Anyway, these are a bunch of morons social distancing in Olympia, Washington right now. I'm just waiting for the Corona rally to start, which should be in just a couple of minutes, but I thought I'd get the chat going first. You guys are seeing me on a delay. Mark, sounds good. Thank you. Thank you, Kathy, for letting me know that I can hear you. So good. Now I can see the chat window right by where I'm watching the feed that we're all sharing here. So, my arm's gone. Yay, they're cheering this guy. I've been listening. In my headphones, I can kind of hear what this guy is talking about. So I'm going to be quiet and get things set up. You guys listen to this right winger. Our rights are essential. Our lives are not, but our rights are. Yeah, so a few minutes ago I heard the cameraman talking to Keith on his walkie, and I think Keith might be the same Keith I used to work with years ago. I didn't recognize the cameraman's voice. That's not to say that I don't know him. Oh, hey, Chris Collins, watching on Facebook Live. Yeah, this is being simulcast right now. It's kind of cool, Chris. Yesterday I tried this.
13.
She wanted to know what channel he was with. You're about the least vile of the ones. I watch you all the time. I mean, these people watch TV and they hate the TV. Yeah, so Chris, I'm streaming this live right now on, I believe, Facebook, because you're watching it on Facebook. And then, let's see, who else is in here? Kim is watching me on Twitter. Kathy's watching me on YouTube. Oh, hey, Kathy. Yeah, I think she is. Kathy, are you watching me on YouTube? If you could confirm that. It has a little YouTube emblem beside you there. So I'm assuming that's where you're watching me. So, you guys are quite delayed. You're about 2 minutes behind what I'm actually saying, so it takes me a while to respond to you sometimes. Let me see if I can bump that up. Okay. Yeah, I don't know how much of a delay Facebook has, but Twitter shouldn't be too bad today. Obviously, there's a chopper there in the background. A Trump flag. What a surprise. Any society will give you a little liberty to gain a little security will deserve to lose both. Something like that from Benjamin Franklin. I doubt that's real. All right. Let me go see what the Trump rally's doing. Yay, Trump. Oh, Kathy, you're watching me through Twitter. That's weird. It's got a little YouTube thing here. Yeah, I lost 2 viewers, Chris. It's the end of my world. Okay, so in the corner I see soon White House briefing, so it's coming up here. As soon as the C-SPAN feed goes live, we'll start watching that. Oh, you're just monitoring the chat window? Okay, Chris. I'll give you overseer power of the chatting. I don't know. It's in Washington, can you be fined for violating this? But on the other hand, what cop wants to go in there right now? Odds are good with Washington. How many people are infected in Washington? Odds are good. There's somebody in that crowd that's infected. Oh, yeah. Patricia, ask Patrick, or you tell me, where I can get one of these so I can tell the people. It's not quite orange enough. I got to adjust the saturation. Hold on, I got to get back to the monitoring here. See where we are in terms of the rally. Okay, that should be up now. Let me check. Yeah. All right, so that's what's going on in Olympia, folks. That is where the virus first started. We're going to kill this. If we can. There it is. Boop. Let's mute that puppy. Okay. Oh, let's close this window. Okay, that's kitty porn. That's pandemic information. There's the state of Washington. Let's go over here. And theoretically, it'll bring up the White House feed for us. On the KSPAN. Let's see what's going on there. So, Trump tweeted that he's going to start at about...
In either event, they should have let us go in. You know, we asked to go in very early.
Oh,
and they didn't
I think it started already.
I think they were embarrassed. I think they knew it was something bad, and I think they were embarrassed.
And that from the president yesterday. Let's get back to your phone.
Okay, no. I was going to say, that sounds exactly like he said yesterday, but that's every day for Trump.
Thank you, Doctor, for taking my
let's shut these guys up for a second.
I've been reading an article in the American Journal of Public Health on the 2000.
Oh, that's interesting. I shut them up on your end, but I can still hear them, which is annoying.
Ebola and Zika. And
let me do it this way.
Takeaway from the article was
no,
there's
just
a
pause
large
them.
difference in the time, in the delay from the detection of a disease to the response.
There we go. So go live on that.
How can we better act on the advice
can I make them
that
quiet?
Public health officials give us once a novel virus like this that's respiratory in nature is
stand by for technical difficulties,
folks. Which in this case was back in early January.
All right,
the WHO
I need to go away, which is fine.
Said that
there we go.
We should assume that community spread is actually occurring, even though they reported that China denies that. And we didn't act on it. We should have been prepared to act on it. And I think the public should be brought along in this process.
Now bring me back in.
For this pandemic, but as a matter of public health messaging all of the time, that we should be
okay, so that's going live right now. Let's go back over there and make that big so I can turn on the sound as soon as it gets going.
I wanted to get your opinion on that.
There we go.
And also,
so as soon as they cut to the White House there, we'll go to the White House.
On the other side of the curve. And
all right. Yeah, Josh, it was from yesterday.
And actually knowing
it is. Trump is a blur.
Logistics. How many tests do we need?
Absolutely agree, Kim. So we got a few minutes to kill here. How's everybody? Hey, what's up, Internet? What's up, yo? Check it out. Subscribe. Make sure to click this thumbs up.
To begin to lift the
I don't know. If you want to subscribe to me, you can.
We'll get a response, Dr.
You can subscribe on YouTube. You can find me pretty much anywhere as KevinlyFather. So KevinlyFather on the Twitters.
A little bit earlier.
And
so we probably need to test
KevinlyFather
5 million people a week
on
would be my
YouTube.
guess. Although
what else? Oh, yeah, and on Facebook.
Estimates.
Don't find me on Facebook.
The testing has to be,
I'm never on Facebook.
The numbers are
so tired
high
of looking at
they're
what
not
people have for
homogeneous
lunch.
the
Okay,
United
can we send
States,
someone with smallpox
and
to visit
really
them?
The testing is about
That's
showing
very
that we are
American of you,
having
Silas.
decreasing transmission within the
Okay,
communities.
and then
So
Silas
it's not so
swore.
much
So
the
Chris, if you
testing
could cut
as the
Silas's feet
data
off, that would be
you can
much
show in your
appreciated.
community, yes, we are having fewer and fewer
and
cases
I'm just curious
because
as
it's
to how
linked to
far,
people
how much of a
finding
delay
the
we have
cases,
here. While we're
isolating
waiting
them,
for Trump
and then
to come
quarantining
out, I'm going to
contacts.
experiment
So that's
a
what
little
it's
bit.
about, right? So you're looking. So the
Let me go to my
testing
feed here.
is easy to point to
We'll be
how many
checking in with
testing,
Daniel Dale
testing you're doing,
for
but it's
fact
really
checking
about the
throughout.
cases
You know what I
in
should
your
bring up?
community,
I should,
right? Let's not forget that.
David
Testing is the way to
David
get to
Mickelson, are you
decreasing
out there
cases.
watching?
So that answers the sort
We
of
should
the
get him in
testing
here, 'cause
question. But
he's the
please
Snopes
remember,
guy.
it's not about
I should.
the numbers
That's
of
what I should
tests,
do.
it's
I
about
should
the
set
number
him
of
up with a
cases.
camera and then
You
bring
wanna
him in
drop
as
those and
needed
continue to
to
drop
live
those in your
fact check
community.
things.
And the testing is
nobody
the way
knows
you
facts
find
like
them
David.
to continue to drop the cases
The
in your
definitive
community.
source.
Now, going back to your first question, so there is no
No,
doubt
Chris, I need you to
that
police
there was a
everybody.
lack of imagination in the United States about
You can't
what the
police
impact
everybody,
of
so you
of
gotta
the
police
SARS
yourself.
or new. So I call the SARS 2002.
Here we go. Okay, so now I can see
SARS,
my
and I
Twitter
call
feed. I'm going to just get a
COVID-19
reaction
SARS.
time here.
And
Okay,
there was
so
a lack of imagination
I'm gonna
of what
clap.
SARS could do in the United States, and we were fortunate
That might have busted
during the
everybody's
classic
earphones if you're
SARS
watching in
outbreak
earphones.
that we were spared. Now
5,
Canada was not
6,
spared, and they took this disease
7,
very
8. This is
seriously
fascinating
and
television.
had a different perspective.
12,
South
13,
Korea
14,
had an outbreak due to a
15,
disease called
16,
MERS, Middle East
17,
Respiratory Syndrome, which
18,
is also a coronavirus.
19,
that
20,
really caused
21,
a big problem
22.
for them in
So
their
you guys
healthcare
are 22
system.
seconds
And
behind
so
me.
They also
So
took
you know.
this disease very seriously.
That's how far
And
in
the
front of
moment
you
they
I
heard
am right
that,
now. So there's
this
about a
new
22-second delay.
COVID-19
So
coronavirus
from
had
what
shown up
I say
in,
to you
China,
typing,
they,
I should see
right
that
away
instantly.
started
So if you do
ramping
type
up
a
testing
comment,
so they could start testing. In
you're going to
South
feel
Korea,
like you're commenting on the thing
is
live.
pretty much
I'm going to see
opening up
it
these days because they
22
were
to 30
so
seconds
aggressive.
later,
But the
if I even
United
bother to
States
read
and
it.
many other countries,
Which
you
Trump
know,
keeps
did
me
not take it
preoccupied
as
once we get
seriously
going
and
here.
should have. But
So I
wanna
was surprised
remind
yesterday. I
people of
had,
what
I
the
think,
flip
283
side is.
viewers
so
altogether.
Many of you, and I believe even the caller, will go back to swine flu, where there was
Turnip is
a
not on.
concern
Kathy
that,
says I turned
there may
the
be a
TV to
swine flu
MSNBC
outbreak,
and a
there
commercial
was
is on, so
national
undoubtedly
effort to
Turnip
make a
is not
vaccine
on.
against
Kathy, I
swine
don't know
flu,
how you're
and
watching
in the
this.
end, we did not
I
have
don't
a
know how
swine
you're
flu
watching Twitter
pandemic,
through
and
YouTube.
instead we
Okay,
had,
cool. So
unfortunately,
guys, you see this
a
shirt?
number of people who got
I'm going to cut my
serious
head off here.
complication from the swine
In
flu
prison, nobody can hear
vaccine.
you tweet.
So,
Oh,
you know,
also, do you
there's
see my purple
always this
pants?
Trade-off.
Look at
Are you
those.
scaring people about
This is
a
my-
disease
this is
that
my
may not
Corona body.
happen versus
Right
are you
there.
preparing them for a disease
That's
that
right.
may
That
happen?
is a lot of potatoes and toilet
in
paper
this
because that's
case,
all I had left.
unfortunately,
So if you're
fact
interested in the
that
shirt, in
Chinese
prison,
had
no one can hear you.
adequately
No one
managed
can
the
hear you.
disease in
Yeah,
country,
no one
and
can hear you
I
tweet.
will admit
This
it,
was
I
designed
one
by
of
my
the
friend
individuals who
Patrick
thought,
Bennett.
yes,
Patricia
you know,
Bennett
China
just put
has
up a
an
link
excellent
there.
public health system. Maybe this
Patricia,
truly
you're
did.
on Facebook. Maybe I
This
can
was a
send that to
cluster
everyone.
in
Hold
a
on.
In a
I
wet
haven't even
market,
tried to
they
chat
really
yet.
had captured that cluster.
Here's the
And
link.
we were good to go. And unfortunately,
Oh,
because
Patricia, you keep
they
going
were
away.
not sharing
There.
the data very well, they had
Let's see if this
not
works.
captured that cluster, and we should have been a lot more concerned. And they were
581?
not as good with the information that yes, this was causing healthcare.
Okay, that went up on Twitter, so I think that worked.
infections and,
So if you guys
infections
tweet
outside
something,
the
I can
facility and
retweet to
community,
all the platforms.
transmissions.
So right
I
now
think
we
if
have
had
people
known
watching
all
on
that
Twitters,
information
we have people
earlier,
watching
we would have been
on
a lot more
Facebook,
concerned in
and
the United States a lot
we have
earlier.
people watching.
So when the
I've lost
president
track because
said
I'm reading
back
the
in
comments
February
right now.
This would basically disappear. It would wash away. Was he accurate?
Yes, Chris Collins just said 280 viewers is about 275 more than
Dr.
one of
Collins?
Silas's shows. It's true.
Not sure if
Because
I
that's
missed
everyone
that
in his
when the
family. He's
president
building
said-
an audience
He said
right
back in
now.
February that this
Silas,
would
what do you want, like
disappear,
8
that
kids?
This would essentially wash away. Those are his words.
So,
Was he accurate?
Kathy, you got it on the YouTube. So I think when I tweet something, this goes out to everybody. So we're just waiting for Trump here, which
This
is,
the two sides.
I mean,
of the
honestly, haven't
coin
we all been waiting for
where
Trump to leave?
Where
all this
you need
time?
to
I look like Trump when I
encourage
talk.
people
I'm
that
doing this.
There's a solution.
I'm watching
So this
myself
is the-
delayed.
And the Chinese were doing the same
So,
thing, right?
it's a good study
they
of
were
Kevin.
busy locking down Wuhan, encouraging
To
people
answer your
that
question,
by locking down
you can
Wuhan, they
see,
were
yeah,
going
the
to get to
saturation's a little
zero,
bit off. That should be a
while
little
at the
more
same
yellow.
time locking down Wuhan
Since we're in
and telling
quarantine,
people they
I'm
couldn't go
recycling my
anywhere.
own bodily
So,
fluids. 'Cause
I
you
can't
gotta
speak
save.
for the president on you know,
Check
how
this
you,
out.
How you're balancing those messages.
I got
to the
masks
community
from
that you
China.
need to
Now
take
these are
severe action, but
KN95.
give them hope
They're
at
not
the same time
N95,
that
so
the end of severe
you can't wear them
action,
for medical
you know,
work
you will
here in
be
the
able to
United
see the new
States.
spring again.
But they're very cool. They're 20
We'll go to
bucks.
Betty next
They
in
got Velcro
Albany,
on them. I'm going to take the
Louisiana. Good
headphones
morning.
off here because
Good morning.
The
Thank you for
sound is
taking my
muted for me
call.
anyway. So
Doctor,
check this out.
I was listening
Put
when
them
you
on
were
like
talking
that,
about how the virus
and
did not
they also have
was
little
not genetically
ear thingies that you can use.
manufactured.
They're
But I
20
think
bucks.
everybody
They're
realized that. They said
KN95.
it
And
naturally
what that
occurred.
is here
But
in the
the
States,
thing
for
that
medical use,
has
you can
most
use
of us
N95.
worried
Somewhere,
and upset
other places
is
on the
the
planet,
fact that
KN95 is okay.
China did not
KN95
let
is the
people
same
know
standard,
it was
except
happening.
that
Neither
it
did
can
the
leak
World
up to 8%
Health
if you're
Organization.
doing
They
heavy
covered
exercise.
it up
But these are the
because-
masks that they wear in
and the
China
fact that
if
it
they're
might
in
have occurred in the
Shanghai and
lab,
the smog
that's
is
a
bad,
plausible
etc.
theory,
So it's
because they
supposed
were
to block
doing
out 95% of
research on
particulates.
bats in that lab.
I got them on
And the thing
DHgate.
is
I'll send it
that
out.
we're worried
Oh yeah, I
that
can
we
get that
didn't
link
get
actually.
notification from the
Let's see,
people
nothing's going
that
on with
should
them.
have been notified.
But if anyone needs
For
a mask,
instance, the early
they come with
doctors that
filters
you
and you
were
buy
talking
new
about that
filters.
noticed
And
it
what that
in
does
China,
is
those early doctors are gone.
Little
We don't
clicks
know
as
where they
well.
are. You know,
Here, this is
and
annoying.
why would you take out the
Wait, what's that
doctors
called?
who might have the most information that could give
AS.
the rest of the world
When
information
they whisper,
about it?
you know that
Thank you, Betty.
that thing where they just make sounds
So,
right
ma'am,
next to the microphone.
you are actually spot on. I
It's
don't
the sound
think
of
anybody would
Chinese
disagree
mask
that
plastic.
the Chinese government, not the Chinese people,
Somebody
are
knows what
amazing,
that is. I have to
right?
wait like
They've
3
gone
minutes for you
through
guys
an
to respond.
horrific
What's that
event
called?
in their
ASDM?
history, as all of us
AF.
are going through in our histories worldwide.
Okay.
But the Chinese government.
So,
clearly
here's
could
the
have been
actual
more
filter.
forthcoming, in the
And these are
information
so
that
these
they
are reusable.
provided
This
us.
can
So
be
nobody's
washed.
gonna disagree with
You
that
see
they
people
could have been
sometimes.
more
Some people have these.
forthcoming,
They have them for their
with
motorcycles. I
that
don't know, Patricia, if you
information.
have one like this.
And that,
But
for
that's what it
example,
is.
Some
ASMR.
of the early whistleblowers,
So
if you
you
want to call
put on
them,
the mask
were
and
called
you
in and
demand
told
to
not
see
disseminate
Batman.
the information of what
And
was going on in their
otherwise you're gonna
hospitals.
take the
That's
city down.
absolutely true.
So the
But,
filter goes in
that
there,
doesn't necessarily mean
and
that,
then you're
they
essentially
disseminated this virus
you're
within their
essentially
community.
breathing through that filter right there.
Also,
That's the
you are, there
N95,
are
but
numerous
it's
labs
classified as
worldwide that
KN95
work
because
on
again, it doesn't meet
coronaviruses,
U.S.
and they
medical
should be
standards. So you're
working
not
on
taking a medical
coronaviruses.
mask away from anybody. But
They're one
honestly,
of the
these
leading,
would be better than
threats
what a lot of our
based on what we
medical
saw in
people are working with
2002,
right now, which is an absolute
that
shame.
These viruses can cause
And then
pandemics, and based on what we see now,
there's a couple of
we
clippy
know
things
they
as
can cause
well
pandemics, so there's numerous labs
to
working
make it look really cool.
on these viruses, and yes, we can never prove
So these
the
clippy
negative.
things go in
so
here,
yes, could
and,
somebody in the lab have gotten naturally infected
There you go. So
from
basically,
these
it looks like that.
coronaviruses and then gone out
I wonder
and
if Panda's
infected other
is
people?
over. I made one for
Absolutely.
Panda already.
Or in
Hold on.
any other lab in the world,
Enjoy the
naturally
microphone.
infected from an animal. But it's always hard to prove the negative. Whereas it's a lot easier to understand what we see with Ebola and plague and
I don't know
all
what
these
Panda did with
zoonotic
hers.
diseases, which is
So,
people
let me get that
naturally
link
get
for
infected
you.
out in the wild or out in
Oh,
wet
is he
markets,
talking? You guys
and
can
we have
hear
lots of
him?
examples of that happening naturally.
We'll go to Stephen
Hold on.
in Daytona Beach, Florida. And Steve, are the beaches now open in your area?
No. My question.
Okay, I might have just muted him. I don't. Oh, I'm sorry, guys. I muted them in my headphones. I didn't mute them for you. So they should be mute now. If they're not mute, if the guy's on the TV screen, Dr. Khan, if he's not mute, let me know, please. So if you're just joining us, we're just waiting for Trump to come out and do his Corona rally. And then once that gets going, we'll be doing commentary, and I can see what you guys say in the chat window as well, so you guys can contribute in kind. Okay. Where'd my whiskey go? There it is. Thank you, Kathy. So he is muted. So I'm just learning this software. This is all... This is basically, I'm an idiot, so... That's what you're going to get. Oh, hold on. There's an ad for Corona. Oh, this might be interesting. Hold on, I'm going to tune this in again, guys. I'm going to stop talking and listen to this.
So I always like to couple the experimental data.
Okay, so there's Trump. Or there's the podium anyway, so we're just waiting for that. We're full screen over there. Let's bring me back. Actually, don't even have to be here. I'm be gone. Here, let's fix the t-shirt while we're here, Patricia. This is just a little bit not quite orange enough. I want you guys to know the kind of detail that Patrick Bennett went to when nothing's coming through from the White House. Is that frozen? Hold on.
Information, what it looks like is
most
people get infected.
He's still
because they
talking.
have direct contact with another person, and that's usually close contact, 10 to 15 minutes.
Let's do this. Let's make sure we're up in real time here. Oh, on white, the green screen does not look good. Come on.
You know that most of it is droplet transmission.
And so if you have a standard sneeze in which you're not using your arm, but you spray in an area, how many droplets potentially could be exposed?
Oh, this is interesting.
So what happens is as you go out to the third power of the radius, the concentration gets lower and lower and lower as you get farther and farther out. So the closer you are, the more likely you are to get infected. And this is why we tell, one of the reasons, although the main reason is to protect you from infecting others before you get sick, since 40% of infection is before you get sick. But one of the reasons you wear the little mask when you're outside is when people are sneezing or coughing, you don't want that to get into your face and nose.
We'll go to Roger in Middletown, Ohio. Good morning.
Oh, good,
morning.
Roger.
First of all, let me say I appreciate the job that they're doing. I want to thank the president for saving my life. I'm 86 years old. I'm a Korean veteran. And I understand that so many people are calling in, condemning the president and condemning the doctor's stuff. They're talking about a primary book. And the government has got the greatest lawyers, greatest doctors. You see 5, 6 people, but there's thousands behind the president, the doctor, and all these people that are working hard. And I went to the store last night. We had to wear a mask. And I saw people run all over the place with their kids with no mask. People die from this thing. And there's no, go back to work. If you go back to
look
work
at the doctor,
and
just
you
like
separate yourself from people, fine. But you carry it and you take it to somebody else, and they take it home to their families. Think of the poor people in these nursing homes who didn't have a chance, and think of the sadness their families going through. Now, do we want to go through that again? I don't think so. I think, if they would have spent the money on these infectious diseases that they spent trying to get Mr. Trump out of office, we're talking billions of dollars they wasted.
The $40 million would have stopped the corona.
Put on cancer or other things like that. And the elections come up, and they're already spending hundreds of thousands of dollars a day to try and get Mr. Trump out of office. It's not going to work. He's got too many brilliant people behind him. And look what they're
I like him.
this
guy's like 80 something, 85, 86, whatever they said.
Spacey.
Okay,
I'm
Roger.
enjoying him.
We'll leave it there and get a response.
Okay, Roger.
Call.
So thank you for that question.
Roger just could have kept
let me
going.
make 2 points.
Roger
One
should
is
get his own little webcast.
prevention is always the best buy, right? Prevention's the best buy when we talk about health. If I want to prevent you from getting cancer or heart disease, or if I want to prevent the next pandemic, it's always the best buy. Preparedness, prevention, always less costly. The second thing is to remember and honor the heroes of this outbreak, whether they're the healthcare providers, the public health people in your own communities worldwide, and all the essential people who don't have the opportunity to stay at home. The person stocking the shelves, the one driving.
Okay, so in my neighborhood, the gardeners are still out. I would have no problem at my particular apartment complex thing here if they didn't do the grass for a couple of weeks. Keep paying the people. I have no problem. I'm paying my rent. Use that rent to keep paying the people, but let them stay home and not go around spreading things. I don't get it. I don't know why cutting grass is essential. At least this week they were wearing masks, which was nice to see. But I don't want them to have to put themselves and their family at risk so that my grass and my leaves get blown. There's a lot of leaf blowing going on. LA's all about leaf blowing. Anyway, back to Omaha.
Pandemic. Good morning.
Good morning. Dr. Hahn, I'm glad that I could speak with you. I wanted to ask a scientific question, a hypothesis I have from just some reading that I've been
C-SPAN's
doing.
the best.
There are millions of people on ACE inhibitors. And when we look at ACE inhibitors, like the prills that inhibit angiotensin 1, they conversely stimulate angiotensin 2, the angiotensin 2 receptor. This virus has a predilection for the angiotensin 2 receptor. I wanted to ask you and your colleagues, would you consider doing a meta-analysis study of the millions of patients who go into ARDS so precipitously after being in the hospital, say, for a week, and then their lungs just collapse? This is a question that I think needs to be looked at and needs to be studied by you as an eminent epidemiologist and epidemiologists across the country. Just wanted to ask your thoughts on that.
Gil, thank you for the question. Dr. Khan?
So that's an excellent question. So there is no
It
doubt
is an excellent question.
that this virus uses what's called an ACE, angiotensin 2 enzyme, to connect and get into your cells. So there's no doubt about that. The American Cardiology Association, the American Heart Association, and others have come out and said, please do not change the drugs you are currently taking for high blood pressure or heart disease, because they may work on those same set of receptors. And there are, sir, lots of studies going on to verify that those drugs are not somehow interacting with people getting this disease. So people are looking at that. But for now, we do not recommend that people change the drugs they are on for their heart conditions.
Deborah in Westchester, Ohio, good morning.
Good morning. I am a retired scientist, and I just wanted to thank you so much for focusing on prevention, because as a scientist, I understand a little bit, a lot about the immune system. For instance, the neutrophilic white blood cell and the role that that plays in our lungs in terms of fighting disease. So one of the things that I'm not hearing from the medical community, and I think you would be the perfect person to convey this, is how important it is right now for us, and no one's going to agree with this, not to drink alcohol, because it suppresses the neutrophilic white blood cell, and how we need our vitamins and minerals to be within normal range. And how dairy, we don't have the enzymes.
That's right, everyone. Don't drink alcohol.
5 years old, and it is an inflammatory food. And the last thing we want to do is have food in our diet that produces that type of a response where we get a lot of mucus. So a lot of eating fruits and vegetables and water right now, getting plenty of water, and have a balanced diet and not too much animal protein is so important.
So if you guys want to cut out and then come back when Trump is on, feel free.
And I'm just not hearing enough about that.
I should actually not start these broadcasts until Trump shows up.
Deborah, thanks for adding
I'm just
your voice
putting
to the
myself behind the podium right now
What type of
because...
scientist were you, by the way?
Well, why not?
Microbiologist.
Thank you very much. Dr. Khan?
Thank you very much. Nice to hear from a microbiologist, and
Dr.
nice
Khan,
to hear
Dr. Khan,
another champion
Dr. Khan,
for
let me rock it,
prevention.
Dr. Khan. Let me rock it. It's all I want to do. Dr. Khan, let me rock it, Dr. Khan. I couldn't do it. Try it at home. Let me rock it because I feel for you. Dr. Khan, let me tell you what I want to do. Want to love you, want to hug you, want to squeeze you too. I want to take you in my arms, Doctor, feel you with my charms, Doctor, because you know that I'm the one to keep you warm, Doctor.
If you smoke, we know that's a modifiable risk factor for COVID-19. So please, if you smoke, there was always a good reason to stop smoking. This is another really good reason to stop smoking.
Feeling for you.
Fruits and vegetables, 7 fruits and vegetables every day to get them in. Sleep is important. Exercise every day, and moderation in your alcohol and animal
I can do a puppet show at the podium.
But self-care is really important. This is a good time to think about your diet and exercise and your sleep regimen.
Ronald is joining us from Suttons Bay, Michigan. Good morning.
Good morning. Good morning, Doctor. I've been listening and doing a lot of research myself, being a retired teacher. The thing that I'm concerned about is when our government's going to hold the Chinese accountable for their actions. If, in fact, they have held back a lot of the transparency that was needed to identify the problem going forward. The second thing is...
No, my daughter stays in her room all day. We have fun, though.
...throughout the world to hold the Chinese accountable at the United Nations. And to
Where's Mr. Trump?
expose them for their inability or unwillingness to allow the world to understand what was going on in their country. As long as we fail to provide transparency to the people, that we are going to have people who are going to question everything that is done. The information regarding the health...
I'm feeling great, thank you, Titch.
Obvious. But the transparency is lacking not only
The funny
in our
wears
country,
off yours much more quickly,
in other countries
Chris.
throughout the world.
Thank you for the call. On that issue of transparency, your response, Dr. Khan?
So,
Dr.
I always
Khan?
want to be very
Dr.
careful
Khan?
when we use the word Chinese, because I want to separate Chinese from Chinese government, right? So the Chinese
I thought he was going to say Chinese food.
Are a whole country of wonderful people who just went through a horrific experience. They're our friends, our family, our colleagues, our neighbors, my students, my teachers, my faculty, right? So let's be very careful when we use the word Chinese, right?
If he had said my mistress...
But yes, there are some members of the Chinese government that could have been more forthcoming about what was going on during this outbreak, and it's very appropriate to think about how can we work with the Chinese government to make sure that they are a lot more forthcoming in the future. And
they were fully transparent. The president said so.
In the book. And for those who read my book, I have said that after SARS 2002, I would never have, that they had gotten so much better, I would never expect to see this again from China, but I was wrong. And I'll be honest about that. And I think
were
it's
wrong.
Because they believe
Shame
they
on
had
you.
contained the outbreak. Regardless, yes, we need to go to a place, and not just for the Chinese government. Again, not the Chinese.
I can reach over the whole audience.
For every government in the world.
I can crush Jim Acosta.
We need to go to a place where we're a lot more
No,
transparent about health information, because a disease anywhere is a disease everywhere, and so information, samples, genetic information, we need to get past this mindset of we're going to hold on to it, we're going to publish this information, we want royalties for it, etc., etc. No, share the information because it can save lives, and a single day can make a difference.
Before joining the University of Nebraska Medical Center, Dr. Khan was the director of the Office of Public Health Preparedness and Response for the CDC. Dwayne is joining us from Mississippi. Good morning to you. Welcome to the
Oh, this is going to be good. Good morning, Dwayne.
Good morning.
Look, I wanted to, Taiwan was early in the game trying to ask the World Health Organization and trying to tell them about this plague.
And the WHO wouldn't talk to them.
They wouldn't listen. And our president did a whole bunch of good things. He didn't say that this virus is going to wash off. That's just another misnomer. But he did a lot of good things in the beginning of this. He had no idea how
Trump
bad
did say wash over us several times.
The World Health Organization was berating him about the head, about everything that he did.
He could be a baseball coach.
Was correct. And then when the truth came out, the Chinese was doing the biggest lie ever. And if we can't hold the World Health Organization responsible for their job, they get $500 million, and they couldn't warn us of this impending pandemic. What is the responsibility? Who do we hold responsible, if not them? Who?
Thank you, Dwayne. Let's get a response.
I think you just
Dwayne,
answered
that's
this
an
question.
Excellent question.
Who do we hold responsible?
I think the honest answer is we're all responsible.
First base.
Each and every one of us, every country is responsible for this global pandemic. We're responsible for our own preparedness systems, and we're responsible, as I said, a disease anywhere is a disease everywhere. So we had a global responsibility for this preparedness for decades. And to be fair to WHO, you know, it's not as if they weren't reporting every day what was going on in China. We did know what SARS did in 2003. We did know it was person to person. We did know it caused healthcare acquired infections. We did know it caused community transmission. And some countries like China and like South Korea and Taiwan, they immediately ramped up their preparedness activities, and they had a much better response than many other countries worldwide. So there's a trust me, there's a lot of blame to go around.
We're one of those
after
countries.
action reports are done, there will be a lot of blame to go around. But right now,
And
WHO
Trump will read it in
is
prison.
leading the global health fight.
I'm kidding.
Right? And the
Trump doesn't read.
And this is absolutely would be an unfortunate time to say, you know, let's halt your funding.
This guy's
and
he's
if we are
excited to
halting
be
your
on
funding,
TV.
I hope it's very brief, you know, because WHO still needs to lead this global fight to make sure we can get out of this pandemic. And there's plenty of time in the future to sort of lay blame where blame potentially needs to be laid.
Wow.
But more importantly, as a public health professional,
Just
for me,
infected the neighborhood.
It's not ever about laying blame. It's about thinking about how do you improve your systems for next time, so we never find ourselves again in our bedrooms, you know, and have a
I love my
strategy
bedroom.
for the next outbreak, for the next pandemic.
One of the headlines and one of the comments by Kellyanne Conway, the president's
Anybody
former
else have a
campaign manager and
strategy
senior counselor, in which she
for the
referred
bedroom?
to
Uh-oh.
COVID-19 flubbing a basic detail. My question to you: why is it called COVID-19?
Now, that's a really good question.
Is it
so
though?
I would have actually thought
The
this
year.
would have
Just
been
say the
called
year.
SARS, severe acute respiratory syndrome, which is what it was called in 2002, 2003. I think WHO was reluctant to call it again what it was called in 2002, 2003, because it was a little different than 2002, 2003. But it's called COVID because it's a coronavirus. So it's a novel coronavirus. So coronavirus infectious disease, COVID, and 19 for 2019. So that's why it's called COVID-19.
And she said that it was 19 because there had been 18 other COVID cases. That, of course, is not the case, correct?
No, the D is for
The 19
dipshit.
is for 2019 was when it was first identified.
Let's go to Regina, joining us from Apollo, Pennsylvania. Good morning.
Good morning. I just want to say that I'm real excited about the people calling in about how cancer is and the diseases are, you know, formulated, like the dairy and all this stuff. I thought that was great. Sugar feeds cancer, and I think that's where we need to go. But as far as the WHO, the World Health Organization, you know, you continue to Band-Aid over what they did to us, but yet the lady calls in from, I believe, Louisiana.
Yes, that's me at the podium.
The nurses in our country need tested.
We're now 33 minutes behind, which is typical. I started keeping track of it at one point because I got time on my hands. And I think it was 42 minutes is the average time between when Trump said we're going to have a conference and when they actually have the big rally. Yeah, it says you're on Periscope, Chris.
Thank you very much.
Regina, thank you for the call and the question.
Thank you, Regina.
So, Regina, your point's well taken, but has the United States, we have a responsibility to U.S. citizens, and we also have a global
thank you, Kim.
responsibility. And
I'd
think
rather
this
listen to
pandemic
anyone
is a
than
good
Trump.
Example of how,
including you.
we don't
You're
focus
included
on
in
things
everyone.
going on worldwide. We leave ourselves
So
open
if anyone out there
for
wants
these
to,
diseases that can happen anywhere. And
in
if we
terms
aren't
of,
engaged in countries
I'm sorry,
like
I'm
China,
hearing an echo
how
of
would we
myself
know
plus
that there's
him.
another
So
disease going on? If we're not
talking
engaged
is
with WHO,
difficult.
how would we have known
If somebody wants to
about this
comment on my
pandemic?
volume level
So
versus
if
their
any
volume
time
level,
in our past,
I've
this
just
is
got
great
a
example
blue
of why we need
desktop
to
microphone right
continue
here
the leadership role we play worldwide
on the podium
with
here at the White
partners
House.
worldwide to
So if my
understand
volume is
the
way
help,
too
to
high or
give
their volume is way
assistance,
too low,
provide that
ideally
public
we
health
should be able to
expertise
listen to them.
worldwide and make
And then
sure
when I
that
have something to say,
we can provide
I'm
that
slightly above
expertise,
them
and we
so that
also
you
then
listen
have
to
greater
me.
knowledge of what's
Because
going
this
on
is
to
all
protect
about Kevin.
Americans.
Dr. Ali Khan, the book is called The Next Pandemic on the Front Lines Against Humankind's Greatest
they've run out of
Dangers.
time.
My final question with less than a minute left, how is all of this going to end?
It's going to end with excellent public health systems.
Thank you, Chris.
It's going to end with support to public health, making sure that we have a system that allows us to identify cases, quarantine control, and quarantine contacts. As I said, make sure we have a health care system that can take care of any hotspots.
Between you guys commenting and the comment,
healthcare workers. Make sure.
No, I can't say that.
Open up businesses. We have good and schools. We have good preventive measures
this is weird.
in place.
Thank you,
Make
Patricia.
Sure we have an engaged.
Did you see the plug for the T-shirt? Here, I'll see if I can do it again.
Populace and communities. Make sure we have a strategy.
No, this is the mask. If anybody wants a mask like this for China, they're $20. It took about 15 days for it to get here. It's an KN95.
Drugs and vaccines. If we don't
you can find them on this site here.
And elimination or eradication with public health, we'll get it with vaccine or drugs. But this will be the power of public health in the end.
Dr. Khan joining us from Omaha, Nebraska.
Oh, and when I chat, it goes right away.
Thank you for being with us.
No, hey, I don't want you to run to dinner. I want you to stay in the house and walk to dinner.
Thanks very much for being with us.
Remember,
Again,
this is all about staying safe.
Around the world, courtesy of Johns Hopkins University. The total confirmed cases, 2.3 million.
Okay. Oh, things are happening there. I'm going to make myself go away.
Now in excess of 161,000.
I just made everything else go away. Hold on.
185 countries. Yesterday at the daily briefing at the White House, the president with this on states trying to reopen and his recommendation.
Since we released the guidelines to open up America again, and this was 2 days ago, a number of
had to put the again in there,
led by both Democrat and Republican governors, have announced concrete steps to begin a safe, gradual, and phased opening. Texas and Vermont will allow certain businesses to open on Monday while still requiring appropriate social distancing precautions. And I can tell you the governor of Texas, Greg Abbott, he knows what he's doing. He's a great governor. He knows exactly what he's doing. Montana will begin lifting restrictions on Friday. Ohio, North Dakota, and Idaho have advised non-essential businesses to prepare for a phased opening starting May 1st.
That from the president at his daily briefing. And by the way, we are posting all of these briefings not only at the White House, but also with key governors around the country. They're on our website at cspan.org/coronavirus. Claire is joining us from Garner, North Carolina. What should happen in your state?
We're just going to keep going here with Clara.
We should stay where we are at this point because they're not ready, because there isn't testing.
Trump is now 42 minutes late.
I went to the store yesterday, grocery store, and the masks people have on. You look around, and I think to myself, nobody knows if you have it, you don't have it. And until that
That's true. I like Clara.
You can lift all the restrictions you want. I'm not going to go to a hairdresser or a restaurant or, this doesn't make any sense. And for the people in the
Look at this.
states,
Before coronavirus, I didn't know I had naturally curly hair.
Everything open. Good. And then all of you that are together, and if you get sick,
now I'm
don't
data for you Star Trek fans.
Fix it for you. That's how I feel. Some of this makes no sense whatsoever.
Thank you,
it's
Clara.
so illogical. And there's people's lives that have died. I mean, we're talking about not winning a football game or something. We're talking about people's lives. I'm 72.
We are
73 in May, and
I love Clara.
Trust me, I'm not wanting to check out yet. So I don't understand.
No, I don't want you to check out yet.
In North Carolina, they're doing a great job, but they recognize it's a step-by-step process, and they're working very diligently to try to get the testing up. If we can test and know who is a carrier, who's had it, who hasn't had it, that allows you and affords you to know where you actually are with this virus. Without
Hold on, I'm going to grab my ballot and write Claire's name in.
And so I don't understand that at all. And I think that the people in New York City would tell us point blank they don't get it either. So that's where I'm coming from. Thank you very much.
Clara from North Carolina, thanks for the call. This is a headline from Bloomberg News.
And I have one more question. Yes, Clara? Where's the beef?
As in Los Angeles.
You guys remember Clara Peller, I think her name was. She was the Where's the Beef lady. I'm old. Hi, Bev.
What should happen? You're in upstate New York. What do you think?
Well, here's what I think. I think that the governor's taking the right steps. Governor Cuomo's stepping up to the plate. He's not playing the political games. This is all politics.
Oh, there's your
We're trying
baseball
to push
reference, Chris.
Our state to going back to work. I get it. I know the economy is hurting, okay? But we have to be common sense people. We have to figure out what's going on with this virus, get some testing going for everybody. I think people should know whether they do have it or not, because they could be walking around with it and not even know it.
People should know if they have the virus. Oh, here they go. Come on. White House. White House. White House. White House. There we go. I'll be back in a second. They're so late, I'm going to have to, like, change my camera battery at some point here. Oh, someone's talking about comfortable boots in the White House. Let's take me here down. No? Hold on. We can make this work. Stay with me, kids. There we go. I can be Dr. Fauci. I'll just be short. There we go. Oh, almost, almost. I'll get it. No, that's the whole podium. No, stop it, Kevin. There we go. There we go. Now I'm Dr. Fauci. I should stay here the whole time and just talk over Trump. Everyone's being so quiet in the press room today. Let's see. Who watches too much TV? Who can tell who's in the room right now? Just breathe. First off, I like your username, but every time I hear it, I think of the song "Just Breathe, Just Breathe, Just Breathe," and that song, I don't even know who sings it. It has one of the greatest lyrics in it, and I think the lyric goes like, "I don't love him. Winter just wasn't my season," which I'm not sure what she's saying. What I take that as is she's saying, "I don't love him because he was a winter." And that's it. Remember, everybody was a season. I'm a winter. I just thought it's a very clever lyric. Sorry, somebody's talking in my ear at the same time. It's a very clever lyric to say, I don't love him. Hey, winter just wasn't my season. Is anyone out there in autumn? Does anybody actually remember what season they are? Is that still a thing, to be a season? I think it has to do with what colors look good on you, right? Like if you're a spring, the pastels look good on you. I'm a winter because I am sheet white. You know what color looks good on me? Purple pants. Purple pants. In contrast against the stark white.
So that's a good sign that we may be getting closer to the start of this. They gave us the 2-minute warning about 6 minutes ago. So, we'll just kind of wait and see what happens next. We are expecting to get an update on a number of fronts, including testing, what the governors will be hearing tomorrow from the administration as they continue to offer those guidelines.
You are a winter, Donna. Oh, here he comes! Here he comes! Oh, excuse me. Sorry.
Thank you very much.
No, that's not me. You're welcome.
I'd like to begin by saying that we're continuing to negotiate with the Democrats to get our great workers and small businesses all over the country taken care of. I think we're getting close to a deal. Could happen. Could happen. A lot of good work has been going on, and we could have an answer tomorrow. And we're going to see what exactly does take place. We're also looking at helping our
They made Pence go away. I can't.
Rural hospitals who have been hurt very badly. The rural hospitals for a long time have not been treated properly. We're looking to help them. And beyond.
He's
So
umber
looking at
colored
hospitals
today.
also as part of the package.
He's not really orange.
And we'll see how that all comes out. But a lot of good things are happening.
I'm not
Some
frozen.
very
I'm
good
fine.
Negotiations.
Let's see.
Just got off the phone with the Secretary of the Treasury, and we have some very good negotiations going on right now. And I think you could have a nice answer tomorrow, but we'll see. America continues to make steady progress in our war against the virus. As of today, we've tested 4.18 million Americans. That's a record anywhere in the world. The United States has now conducted more total tests than all of the following nations combined: France, the United Kingdom, South Korea, Japan, Singapore, India, Austria, Australia, Sweden, and Canada. And our testing
combined.
Is expanding very rapidly.
Notice South Korea is not in there.
Millions of people. So we've done more testing than all of these countries combined: France, United Kingdom, South Korea, Japan, Singapore, India, Austria, and Australia.
Wait, did he say South Korea?
Sweden and Canada. That's something, right?
Sweden and Canada.
We're doing a great job. We are.
Because everything is about comparisons. It's all about numbers. This is a sporting event to him.
A lot of our military people, our admirals, our generals. One of our great admirals here has done an incredible job. You haven't slept too much in the last 2 months either. Look at him.
That's why everybody does a great job, because they don't sleep. That's in Trump's
me,
eyes.
President, you look tired. I said, I should be tired. We should all be tired, but we have to win, right? Yes, sir. Tomorrow, the vice president will lead a call with our nation's governors from FEMA headquarters, Mike.
Yes, sir. Do you really lead a call?
More they could do and do together to develop locally tailored testing strategies, working very hard with governors now on testing. We want to help them out. Before the call, we'll send them a full list of all of the large laboratory machines in the states. They have a lot of machinery in the states that some aren't that aware of, but they're there, and they're really high-quality machines, by the way. And the potential capacity of those machines, if they're fully utilized. A couple of them didn't know that they could be utilized in a different manner. They were only up to 10%, and they can go 90% more. Many governors are still relying on their state laboratories rather than the full and much larger capacity that is available to them. As an example, commercial laboratories such as Quest and LabCorp, these are massive laboratories that can handle a lot more than they're being sent. A few days ago it was at 30%. They were only at 30% capacity now. I don't know, probably the same.
Because no one can take the tests.
In addition,
they don't have the swabs, they don't have the reagent.
Big research labs. There's tremendous capacity out there. And
huge labs, chocolate labs, research lab, yellow labs.
Machine, which just came about due to the research during this little short period of time, and it's very quick. But these labs can do it very quickly also, and they're massive. They can handle much more than the machine.
By the way, they're trying to train dogs to sniff out the coronavirus.
We continue to procure millions of swabs, test collectors.
Swabs.
I have something here. Just happen to have it's a swab. Looks innocent, not very complicated.
Show us how it works. Show us how it works.
Looks like. Should I open it? Does everybody? Open it up. I will.
He's an orange lab.
I will.
Open it up. Don't! Someone can use this.
This is what it's about.
Don't open it. Oh.
Right?
It's just a big Q-tip. You could have just said it looks like a long Q-tip. Would have been fine.
Reminds you of this, right? One's a swab, one's a Q-tip. It's actually different.
Now he's going to duct tape two Q-tips together and say, "Problem solved. You're welcome, America."
So this is the swab, and we've ordered a lot of them. They have a lot of them. Some of them.
The president
some of the states
is holding up Q-tips.
The states don't know where they are.
It's where we are.
And but that's it.
Yeah.
Maybe we give this to Karen. Perhaps she'll take an extra
test. What's that slurping noise?
But this is a big deal. And we're working on it, and we're working with the companies, and I think in the end we're going to have a tremendous success. Nobody is close to us. No country is close to us. In fact, and I appreciate it.
In terms of success,
the Wall Street Journal.
South Korea has 230 dead.
He's a highly respected gentleman, Christopher Demuth, and this piece was just in the Wall Street Journal. Weekend edition, and Trump rewrites the book on emergencies. That's what's happened too. And we just read one paragraph. He's given pride of place to federalism and private enterprise, lauding the patriotism and proficiency of our fantastic governors and mayors, meaning I do call them fantastic when it's appropriate, and our incredible business leaders and genius companies. I guess I probably use those terms too when they're doing a good job. When they're not doing a good job, I don't use those terms. Our heroic doctors and nurses and orderlies and our tremendous truckers, they have all done good jobs. By shouting out many of them by name and documenting their deeds on a fully daily basis, he has vivified the American
he just read
way
daily
of
as
action.
fully.
Once it was reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused.
What? What did
when
he
asked
just?
why
What?
he has not issued orders for nationwide home and business lockdowns, he has emphasized that the intensity of the epidemic varies widely and is best met by calibrated state and local judgments. That's the judgments of governors and local people. And added pointedly that such steps would conflict with the Constitution. But very importantly, he's just a very respected gentleman. To see this was a very nice feeling. Not for me necessarily, but for all of the people that have worked with us. I mean, they've worked so hard, and we've developed tests that are so fantastic. We've come up with things that nobody had ever heard of, and we did it during this pandemic. We did it under pressure. It's called reaction under pressure. It's pretty amazing what our people have done, and that includes all of our military people and our CDC, just about everybody you can imagine, including Tony and Deborah. And they work long hours. There's nobody that's getting a lot of sleep. We're close to finalizing. I want to thank the writer, Christopher, for this article, and it's a great article. That was, frankly, the least of it, what I read. It was a great article. We appreciate it.
From what
We're
you read.
close to finalizing a second partnership through which a U.S. manufacturer would convert its existing plant to produce over 10 million additional swabs per month. And we should be ready to announce this in a very short period of time. We also are going to be using, and we're preparing to use, the Defense Production Act to increase swab production in one U.S. facility by over 20 million additional swabs per month. We've had a little difficulty with one, so we're going to call in, as we have in the past, as you know, we're calling in the Defense Production Act, and we'll be getting swabs very easily. Swabs are easy. Ventilators are hard. Ventilators are a big deal, and we are now the king of ventilators. We have so many ventilators.
He's the ventilator king.
I said nobody
Come on down.
that needed a ventilator has been turned down. It's pretty amazing. Nobody.
Where are you going to send him to?
We're working with the world-class team at Oak Ridge National Laboratory to use its injection molding capacity to potentially produce over 10 million collection tubes per week. That's tremendous numbers. In the meantime, the supply chain and logistics task force continues to surge testing and needed supplies all throughout America. Mike's team and the task force, they just met. They've been meeting virtually every day. And
I'm subscribing to the White House Journal, the Wall Street Journal right now.
Doing a great job, Mike. You've been doing a great job.
I used to be.
Many governors are doing this incredible work, and they're working with us very closely on testing and working in their states. And again, it should be a local thing because it's all these points within a state. But we're helping them a lot, and we want to help them a lot. We're going to help them more than a lot, actually, if you think about it, with what we've done. Think of it, we've done more than all those countries combined. We're encouraging them to share their successful strategies with other governors. Some of the governors are doing a better job than others. The robust capacity that we've brought online will empower governors to deploy sophisticated strategies so they can safely reopen their states. Some people believe in testing very strongly, and other people believe in it less strongly, but still it's a very good thing to have.
Everybody wants testing.
Some people believe in it like they can't exist without testing, and other people don't believe in it nearly as much. They can see how they're doing.
You're the only person.
And they feel how they're doing. And they've been pretty vocal about that. I think you know pretty much who I'm talking about. But I believe if they
Everyone?
want it, we should give it to them and get it for them and work with them.
Yes, you
must
should.
remember
Yes,
that
you
the
should.
Governors wanted to have total control over the opening of their states, but
Which they
now
do. That's the
want to
Constitution.
Have us, the federal government, do the testing. And again, testing.
Yeah, that's the welfare of
local.
the
You
nation.
can't have it both ways.
That's in
Testing
the
is a local
Constitution
thing.
too.
And it's very important. It's great, but it's a local thing, and we're going to get it done to a level in a very short period of time, because all of the swabs are coming in, all of the necessary materials. A lot of them, as I said, are already there, but a lot of people don't know that yet.
Yeah, there's swabs in all these states, but the states, they don't know that they're
testing at
there
a level-
because they're hiding.
Already we're doing
like
testing
Q-tips.
at a level nobody's ever done before, but we'll be doing testing at a level that the biggest tester in the world will be very happy very soon. And it's very much like ventilators. You don't hear the word mentioned.
The biggest tester in the
and
world.
It's much tougher when you have to build these machines. We built thousands of machines. We'll more than help the governors, and we'll make sure that everything goes well, just like it did with ventilators, just frankly like it did with face masks, on a much easier subject. As face masks, again, everything's easier than a ventilator. Ventilators are tough. But now, I spoke yesterday with the president of Mexico and with various other countries. We're going to be helping them with ventilators. We have tremendous numbers of ventilators. In fact, I understand that Governor Cuomo is going to be sending up to Massachusetts some of the excess ventilators that we were able to get, and that's great. I think it's a great thing. The number of new hospital admissions is also significantly down. When you look at these numbers, it's a good thing to see, other than the fact that we also know how people have been just ravaged by this curse, by this horrible scourge, plague.
Linda, no, he hasn't said anything new, but he did bring out a swab. He opened it up and then held it up next to Q-tips.
50% decline over a 9-day period in New York City. That's a fantastic decline. It's a beautiful thing to see after going through the opposite. We continue to see improvement with declining trajectory of cases in Seattle, Detroit, New Orleans, Indianapolis, and Houston metro areas. More evidence that our aggressive strategy is working, and I thank the American people for their selfless devotion. The American people have done a hell of a job. We're
some of them
saving countless lives, though, and again, I'll say it because I always wanted to say, well, can you leave it open? Nobody ever heard of anything like this. Not since 1917, more than 100 years ago, has anything like this happened.
1918.
And in those days, they had no real communication, so you couldn't say go inside. People just died. Almost 100 million.
There was no communication in 1917 or 18.
Tough. So the American people, what they've done is incredible.
No
and
smoke signals.
And you see people.
No newspapers.
Picketing a little bit, and they want to get out.
No
they
way
want
to communicate with anybody.
With their lives, and that's good. But they have learned a lot. They've learned about distancing, even now, at least until this thing totally goes away. They've learned about their washing their hands and all of the different things that we've been talking about ad nauseum for so long. And
ad nauseum, yeah.
They get it. And some places the governors are ready to go, and other places they can't go yet, and they won't go. They have to have it safe. I want it to be safe too. It has to be safe. And again, I have to say this. I can't emphasize it strongly
1917
enough.
Was the movie, Chris. That's probably where he gets it from.
I'm probably going to show you charts of some of the countries that are really having
We
trouble.
did have airports.
And one in particular is having
Marfa
a massive
says we had
problem
airports. We did.
Where they said,
ever since the
"Let's go.
ramparts.
We're just going to keep going. Well, they're the lines that we're famous for now. Some are flat and some are up.
We're famous
like
for the curves.
Ship. This country is, and they decided, let's go and let's wing it. It's they thought it was okay, but it's a problem. It's a big problem. And there's another couple. There's one in particular that everybody thinks did it, but the people are staying in. Okay,
what?
The head of a country doesn't have to say stay in. These people are smart people. They know what's going on. They see what's going on. So,
have you met Americans?
They can say they're not doing that, but the people are staying inside. There are not a lot of people outside sitting at cafes, despite what the mode of a country is. But if you look at Europe, most countries have done this. A couple tried not to. Italy tried not to, and they held it. And Spain tried not to. They went that way. France tried not to. I mean, nobody wants to do this. It's a brutal step. We're going to close down your country. Who ever heard of a thing like this? But we would have had millions of people die if we didn't do
China.
this. Millions of people. And I believe that, Mike. I think, in looking at things that we've been looking at over the last couple of days, I think, and really over the last couple of weeks, from the time we did it, shortly thereafter, I said we made the right decision in closing down, made the right decision on borders.
Remember, Trump didn't close anything down. He hasn't closed
from China,
anything
banning
down.
ultimately people coming in from Europe. But we would have had millions of deaths instead of, it looks like we'll be at about a 60,000 mark, which is 40,000 less than the lowest number thought of. So this isn't a case where people would say, oh, we would have had
Well, the
that
lowest number thought of was 0. But
it's similar to a flu. It's not the same thing as a flu at all, because if we wouldn't have done anything...
It's similar to the flu, but it's not the same thing as the flu at all.
It goes from 27 to 35, 40, 50 sometimes. It's over a long period of time, much different. It's even a much different death, to be honest. It's a much different death. This is violent. CMS is finalizing new guidelines for doctors and patients to resume elective surgeries. It's a big thing. A lot of hospitals were closed. They couldn't do any elective surgeries. They'll be able to start doing that. Procedures
I was
and
thinking
medical
that
care that
the fact that
needs
if you
to be
can't
done
do
in
elective
person,
surgeries, you can't stay
as
open as a
long as the
hospital,
rate of
the
infections
system is
remains low in a
broken.
community,
If you
we
can't
want
survive
patients
without
to be
boob
able
jobs,
to
there's something
go to
very
their
wrong
doctors, get
with the way America
clinically
takes care of its people.
tested and have work done, surgeries.
It's very
receive
violent death,
treatment
Linda.
for chronic conditions and resume
The virus comes
preventative
out
care, so
and
we'll be
beats you with a baseball
allowing
bat.
that to happen very soon. We had no capacity in the hospitals.
This is
with
true.
what
That's why you
happened
never see any of the dead on TV.
with the plague. We had no capacity to do it. If your doctor believes you need a treatment in person, you can get a treatment now. You can and should get a treatment now. We are asking that healthcare facilities have plans in place to keep patients safe during their visits. Some places like New York, New Jersey, where they really got hit hard, it's going to be a little bit tougher. They've done a great job, but they really were a center. I mean, they were a center. I was watching that. It was incredible. But now they're leveling off, and I think they'll be coming
He
down
was
very
watching.
soon.
He was watching New York.
Administrator
in New Jersey.
Seema Verma will be telling you a little bit more
Administrator.
about it. Mike's going to say a few words. Seema will then speak, tell you a little bit more about that. My administration continues to execute our massive military operation to supply our hospitals with equipment they need and beds if necessary, but it looks like we're totally covered on beds. We have plenty of beds. It's highly unlikely. That would be bad news if we needed more beds, but it looks like it's going just the opposite direction.
Good.
I want to
Good,
thank Governor Cuomo, the relationship there for this whole thing. We're building
It's
hospitals.
everything is
Very
about
good. We built
relationships.
a little bit more than we needed, and that's good, as opposed to building a little bit less. That's not good. But he's worked very well with us. The
Oh,
governor
thank you for
of
explaining that.
Louisiana has been great on the bed.
So we
on
had
that
enough beds.
whole
Good.
situation with
Not
the
enough beds?
Frankly,
Wait, what did he say?
the
Not
governor of
good?
Michigan
Not
was
good?
very
Not
good
good.
with us on
And her name is?
beds. You know, it's a very complex subject.
You know, the woman.
Buildings,
Her name?
or you have to do tents, or you have to do a lot of different things, a lot of different ways. But the Army Corps of Engineers was fantastic. They were fantastic. Florida, likewise, Governor DeSantis. And I could name probably 6 other locations.
You can't name Whitmer.
I'll tell you
You
one.
can't name Whitmer.
California was fantastic. He was really good. He was really good. And I
Newsom?
appreciate the fact that he said what he wanted to say, and he wasn't letting the press force him into saying
Gavin
something
Newsom
that he
is a
didn't want to
huge
say. So I
suck ass,
appreciate it
and I'm
much.
very happy that that's the
Governor of
case, because I'm in California.
He really he worked very hard. We worked together. He worked very hard. The federal government is currently procuring more than 100,000 ventilators through new production or purchases, with thousands already delivered. We've delivered thousands of brand
I know,
new
I saw that.
ventilators all throughout.
DeSantis couldn't figure out how to put on a face mask, so he just left
New
the
York
bottom
would be,
hanging.
I guess, the biggest user. And they are now.
This is my impression of
taking
Ron
some their
DeSantis.
excess ventilators, which is great, and they're sending them up to Massachusetts. I think it's 400 and that's a great thing. Our total supply of ventilators continues to exceed by a lot total expected demand. Governor Cuomo said today that no one who needed a ventilator was denied a ventilator. That's a beautiful statement. I appreciate it. And all governors are in
you
that same
appreciate it.
position. We do have a clip that I thought would be appropriate to put up today.
Campaign video.
It'll take 2 minutes, and I think you'll find it interesting, but we appreciate it.
Oh, boy.
And let's see if we can do that. You'll turn out the lights, and we'll see if we can do that. Thank you.
Oh, they're going to turn out the lights. Oh, it's going to be Cuomo saying nice things about him. All about praise. And they're not giving us the audio feed. Because, you know, Trump's White House.
We bent the curve. We flattened the curve.
He's a good-looking guy.
Government did it. People did it. But government.
Trump is interrupting him, says he's a good-looking guy.
Actions, right? We had to double the hospital capacity in New York State. That's what all the experts said. President brought in the Army Corps of Engineers. They built 2,500 beds at Javits that Michael and Northwell were operating. It was a phenomenal accomplishment. Close to 1,000 people have gone through Javits. Luckily, we didn't need the 2,500 beds. But
Is
all
Pence
the
alive?
projections said we did need it.
Look at him. He's not moving. Somebody want to get him a ventilator?
These were just extraordinary efforts and acts of mobilization. And the federal
sexual.
government stepped up and was a great partner. And I'm the first one to say it. We needed help, and they were there. State and local governments were fantastic. The hospital system was fantastic. New Yorkers were fantastic. And that is an undeniable fact. Just look at what they said was going to happen. CDC, Coronavirus Task Force, Cornell, McKinsey, all of them. And they had a line up here, and the actual line is down here. What do you owe the
On my head?
variance to? Heroic efforts on behalf of people as facilitated by government, federal and state.
Okay.
Something else. Are they finished with it? They left.
Yeah, Trump was waiting for. Trump was waiting for Cuomo to say something nice about him, and it wasn't in there.
Ventilators. No. Andrew had something else to say. That was
Trump
really
is
nice,
upset.
We won't go through that.
Yeah.
But he really, I mean, it was
Sorry.
really,
so sad.
A good statement. Do you want to put the rest of it up, or do you not have it? I just think it's so good because it's bipartisan. You know, this is not about Democrats, Republicans. This is
He
about
said Trump did a decent
thing
job.
that hit our country, the likes
And
of
now
which
Trump wants everyone to see it.
has never happened to us before. Wars, those wars, Civil War, sure, but the First
Civil
World
War,
the
sure.
Second World War, they're not fought on this country. This is being fought in this country, but it's being fought in 184 countries all over the world. It's terrible. But I wanna
185.
thank
It's
Andrew
185. He has never gotten that
Cuomo
number
for
right.
the, statement. He
Every
actually,
time he
if you
says
go a
it's
little
in
bit
X
further,
countries,
it was,
he's never gotten it right.
it
Not
was
once.
even far beyond even that. So it was good. You remember? Huh?
Huh?
Well, that's okay. Whatever. But it's.
He said whatever.
Some
He's mad.
really good things, and
He's
that's
still on it.
makes
He still
people
wants
feel
to hear
good.
Cuomo.
Actually, the Wall Street Journal, Christopher was saying, I want to make people feel good too. I want to make, when they're doing a good job, I want to make people feel good. I want the Admiral to feel good. He's worked so hard. Mike has worked so hard. And it was very nice. It was on this morning. It was Andrew this morning.
It wasn't. It's from April 17th, by the way. Trump just read it this morning.
But you'll see, it was really a very nice thing that he said, and people really appreciate that because they've done a great job. The federal government's done a great job. I mean, with all of it. And
Unless he's talking about what Cuomo said, but
the swabs are. That's easy. We have them coming by the tens of millions. We have them coming at a level that you'll have so many swabs you won't know what to do with them. That's easy. So they'll all be there.
So many swabs you won't know what to do with them.
They're learning
Know exactly what to do with them.
capacity that they
Use
didn't
them for
know about,
tests that we can't currently
that
get.
we have in the various labs, including academic. They have to remember you have a lot of these big colleges that have labs that are totally ready to help. But I want to thank the dynamic
They are ready to
ventilator
help,
reserve.
but nobody has the swabs
what
because
they've done is incredible. That's
you're showing them in public
capital
next to
DVR,
Q-tips.
by the way. An innovative public-private partnership. That's what we created. We're gaining access to up to 65,000 additional ventilators in hospitals across the nation that can be redeployed very quickly to areas with the greatest need.
Oh, hey, David.
When they're not in use. And we right now have almost
David, I might have
10,000
to have you fact check
reserve.
things.
We've been able to give
I should
away
get you on camera and
thousands,
then just pop you in
we
like
helped
this.
Andrew, or
Let's
we
go to a
helped,
fact. Oh, not like that.
Phil in New Jersey
Wait.
is doing a great job. Andrew would tell you that
There we
too.
go.
They have a very
Like that.
good
There we go.
relationship working together.
Let's bring
and working
David
with,
with
us.
Snopes in here. David?
But we have now.
Well,
we're
we can
back
set that
to
up for another
almost
time.
10,000, and this is after giving away tens of thousands of ventilators. And we're going to fill up the reserves of states. We're going to work with them so in case this happens again. But we're also going to help other countries. I was telling you, the president of Mexico.
The
we're gonna
federal
be sending,
stockpile.
A pretty large quantity to Mexico. They very much need them.
Maximum
and to
movie
other
time.
countries
Hold on.
where they need them. I've had about 6 calls with leaders of other countries, and they need them. They're hard to get done. We did. Our company
what
stepped
happened?
up and they did an incredible job. Some of them were automobile companies, and they take an assembly line and they'd say, "Guess what?
No.
We're making ventilators now for a while." But
Sorry,
because
kids.
of these
Hold on.
historic steps that we've taken, I remain confident that every American who needs any of this equipment, any of the
There we
things
go.
we're talking about, will either have it now, already has it, or will shortly have it. Through the Project Airbridge, we've completed 64 flights carrying over 600 million pieces of personal protective equipment, such as gloves, gowns, and other medical gear, with 50 more flights scheduled in the very near future. The team doing that is an incredible team of military people and young geniuses. Some are older geniuses, but mostly younger geniuses, I think I can say. Some are people that made vast amounts of money in Silicon Valley. And, you know, these are very smart people. The job they've done is incredible.
I just reached for my readers. They weren't up there because my headphones were. I'll fix it.
$700 million. I said, that's good. You want to work for the government? No, I want to help our country, sir. And it's tremendous brain power. It's a beautiful thing to see. Young, incredible people that love this country, and they worked with the military. Admiral, you would say they were pretty smart, right? Yes, sir. They were in the upper scales of IQ. Yes, they were the upper. They were the top scale, I'll tell you. And they're great people.
The top scale of
FEMA's
IQ?
working to
Stop
commit
it.
another $384 million to produce
God.
another
There
64
we go.
million gowns for healthcare. These are the highest quality. Where
Everything is the highest quality.
when you put them on there.
Because I'm the ventilator king. Come on down.
very important
Can't
quality of the
breathe.
gown
Choking
is
on
very
your
important.
words.
It's
Come see the ventilator
people in
king.
different places, different countries, they're wearing gowns with cuts in them, and these are very safe. I want to thank America's textile
What
manufacturers
is
for their
he talking
partnership in this
about?
remarkable undertaking. 2 U.S. companies, Hanes and Standard Textile, are on track to produce 5 million gowns by the end of the month. And that's really moving. That's really moving. 2 great companies, you know.
Moving
the companies.
like
Another
the
great
feeling or
American company,
moving
Honeywell,
moving along?
recently began manufacturing N95 masks in Rhode Island.
Yes, they did.
Where they converted a factory in less than 5 weeks instead of the 9 months it was normally expected to take.
So
they've
many,
already
many
done it,
words.
and they did it so rapidly. 5 weeks instead of 9 months. It's amazing, the spirit of this country. It's really about the spirit of the country. We said, do it fast. But they did it in, and this was a major conversion to this is a different world. Honeywell is hiring more than 1,000
Different world.
American workers to produce 20 million masks per month. 20 million masks a month. Thanks to the Defense Production Act, we'll be receiving another 40 million masks over the next few weeks. And I also want to thank 3M because they really stepped up. We had a little dispute at the beginning, but that got worked out quickly, and they've been doing a great job, 3M. They really have been. I want to thank
That's
their
very
great
moving,
CEO.
David.
We had a little skirmish, but it worked out well. And they're doing a
Yeah,
lot
because of
work
intellectual
right
property.
now
But
on
3M
masks
stepped
other
up and
things.
said,
This
yeah, other
production
people can
is,
use our
in
masks
addition
or
to the
make our
55
masks,
million
and we'll get a penny
N95
on it.
masks my
And
administration has already distributed.
I don't know
Plus
if you
we
call it a
ordered,
skirmish, though.
and it's coming in soon, 500 million masks. You would think What are you going to do with them? They get used rapidly.
Yeah.
In addition to that, as you know, we
Everyone knew that, but you.
masks now. Great company in Ohio, recommended by the governor of Ohio strongly.
With some good
And
liquid.
It's doing very well, and they're sterilizing. A lot of the masks can be sterilized up to 20 times, so that's like buying 20 masks. And I always wondered, why aren't they sterilizing these masks? They're pretty.
Trump's running out of battery.
Sophisticated masks, and
You can
some
see.
you can't because of the material. Others you can.
Right there.
But we have.
There's his battery.
Actually, 2 companies that do this, but one company I know very well in Ohio, and they're doing a great job. So they're sterilizing masks up to 20 times. You can sterilize a certain type of mask. To these numbers in perspective, and to put them into perspective, American healthcare providers use an estimated 25 million N95 masks nationwide in a typical year. So a typical year, 25 million. That means we've secured nearly 4 times as many N95 masks in recent weeks as we would in entire healthcare industry during a typical year. Over a matter of couple of weeks, we had more masks than we would do in a year. Think of that, over a couple of weeks. Moreover, we're bringing supply chains back home, and we've learned a lot about supply chains. We've learned that it's nice to make things in the U.S. I've been saying that for a long time. One of the reasons I ran for office, because we started making things everywhere but here. And if one thing comes out of this, more than anything else, is that we should make product in the United States. And these supply chains, they sound wonderful. But if one country has a problem, the whole chain is ruined. And I've been saying it for a long time. I ran partially on that. I ran on that, and I ran very strongly against China. And then we made a great trade deal where they buy $250
He just figured out how
billion.
chains work.
They're supposed to. And they're paying tariffs. They paid us tens of billions of dollars. I've given $12 billion one year, $16 billion another year, and $19 billion to our farmers and ranchers who were targeted. But,
China does not pay the tariffs.
China and other countries, the way they were ripping us off, they were ripping off our country. And China understood that. I mean, China fully understood that. And they're big, strong, smart people. And I wasn't friendly, and it wasn't a friendly situation. And we ended up making
same shit as every day, Kim.
an incredible deal with China for tens of billions of dollars of product, $40 to $50 billion to the farmers. The most they ever spent was 15 to 16. Now they're supposed to spend 40 to 50.
27,
now, of course,
but okay.
The virus came along, and I'm not happy. I let them know I'm not happy.
Oh, guys,
So,
he's not happy.
You know, we had a great relationship we had a very bad relationship with China. Then we had a good relationship
We
because
did?
we made a great deal. But we're not happy. This is not a good thing that happened. Came out of China, so we're not.
This is not a good thing?
We're not in a position where.
I've watched so much Netflix, though.
But the deal itself is great. The deal is, it's going to put many.
Why are we talking about the Chinese trade deal that doesn't exist yet?
All of that has to be taken into account when you look at all of the people that are dying in our country, but all over the world. All over the world, people are dying.
Yeah.
I had a G7 call, and their economies are in tatters. They're shattered.
Mm-hmm.
The G7 countries. You have Japan,
Shattering
and
is for
Germany,
glass,
and France.
tatters is material.
Different countries. Italy. Look at what happened to Italy. Look at what happened to these countries.
I would say he mixed his metaphors,
Look at what
but he
happened
doesn't
to
understand
Spain.
what a
Look
metaphor
happened
is.
to Spain. How incredible! It's just been shattered, and so many other countries
Just
are
the
shattered.
best words. Best words.
So nobody ever thought this could have happened. A thing like this. It's very, very sad.
No, everybody
But
knew
we've
something
learned
like this could
It's
happen.
about supply chains. I just saw yesterday where when the auto industry gets back, they have a problem because there's a supply chain.
Yeah,
going
they
through a different
performed, the
country.
Stones performed Shattered Tatters
And this has been
yesterday
going on for years,
on
for
the One World
decades.
thing.
I always said it was no
They're
good.
old.
Why do we make it? Why do you need a supply chain? Very simple, make your parts here. They get one part from this country, one part from that country. It's all over the place. The problem is if one country has a problem, you have no car or whatever it is you're making. So we've learned a good lesson. I think a lot of smart people knew that before.
Yes, they
But
did.
we've,
Yes, they
distributed many
did.
hundreds of millions of masks.
He did not.
This pandemic has underscored the vital importance of reshoring our supply chains and bringing them back into the United States where they belong, where they should have never left. What happens if you're in a war and you have a supply chain where half of your supplies are given to you by other countries? Who are the people that thought of this? These are globalists. It doesn't work. It certainly doesn't work during rough times, bad times, or dangerous times. So we're going to continue to fight the virus. We're talking to China. We spoke to him a long time ago about going in.
If he's even going to take questions. He's been out here a while now.
And we weren't exactly
He's been out here one battery.
If you look at some of the investigations that are going on in terms of World Health Organization, and I'll take it a step further. World Trade Organization too. World Trade. We're
going to talk about the trade organization. And we never won.
Many years ago, the World Trade Organization. From the day China came in, that's when China bloomed. They were mainlining it, and then boom, they were up like a rocket ship because they took advantage.
This is mainlining, not flatlining. It's mainlining.
The World Trade Organization.
They were mainlining it.
They were a developing nation. China was a developing nation. They make the cars, they make the plant, they make everything. They make everything.
Still is.
And they're a developing nation. So we've had I might have gotten elected to a certain extent because of China and other countries. One of my big things was trade. The United States is getting ripped off in trade. Now Japan is paying $40 billion and buying a lot. That's before we even do the deal. U.S.-Mexico was a great deal. The NAFTA was one of the worst deals ever made in trade history. And I would also put the World Trade Organization in that same group. So I was very tough on these countries. With China, we made the deal, and we became friendly. But then this—
we don't have a deal with China, but anyway.
This is tantamount. This is something that's really incredible. I do want to read—
It's tantamount. He doesn't know what tantamount means. Oh, he's going to read something.
Today on television,
he saw.
I was looking and I just said, that's an
I'm
interesting
telling you, he's getting
statement.
very Christopher
We'll
Walken.
talk about the Democrats.
I just saw so many.
Bear, good guy, smart.
Thousands and thousands.
On February 19th, there was a Democratic debate in Las Vegas.
And they never said
February
coronavirus.
19th. That's way after I closed entrance from China into our country.
Which he didn't.
So Brett goes, on February 19th, there was a Democratic debate in Las Vegas. 3 words weren't said during the debate: virus, coronavirus, or COVID-19. Those 3 words never came up. That was, I just thought it was a very interesting, because, you know, you hear these people, some of the people, the Democrats said, oh,
yeah.
This, that.
Because the moderators suggest the topics.
Now they bring it up because you see what happened. So now, but they didn't bring it up. But I brought it up. I brought it up a long time before I made the trade deal, and I was not easy to deal with. I was not easy to deal with. They understand.
No, you're not
We
easy
still
to
have
deal with.
25%
That's the
of
first thing he said right today.
$250 that they have to pay us, and it's a lot of money. We've taken in a lot of money, and we've had a lot of beneficiaries, including our farmers and ranchers. So
there it is again, beneficiaries. He thinks beneficiaries is a word. You know, people who fish for banners.
The plague. Therapies to me are the most exciting. The vaccines are obviously so important, but the therapies are immediate, you know, and we have some things that are really looking good. Really looking good. We call COVID Treatment Acceleration Program. We're accelerating all of these great companies that are looking, and we have government agencies looking too, NIH. This extraordinary program is slashing red tape to speed and development anti-rival, and if you look at what we're doing in terms of the speed, it's unrivaled. It's totally unrivaled. There's never been anything like it. The FDA and Dr. Stephen Hahn, a highly respected man from a great institution, left that job to come here. The job he's doing is incredible. And we're working with Scott, his predecessor, who's terrific. We're working with a lot of people, but the speed of development for antiviral, antibody, and immune therapies is at a level that nobody thought even possible. And I will say this, we're getting very good results. It's a little soon yet, But if we could find the therapies that would solve the problem, if somebody has a problem, we can get it taken care of so it's not so devastating as it has been. With that, I'm going to ask Vice President Pence to come up, and I have to say it's a Sunday evening, and this man has not stopped. He's working, we all are in all fairness, but he's been working with his task force and everyone else round the clock.
He's always got to get himself in there, too.
Thank Mike. Thank you, Mike.
Thank you,
we
Mr.
all
President. And let me echo your words about all the dedicated men and women on the White House Coronavirus Task Force and the team
and
that
your
you
leadership
assembled in January, and some of whom are with us today. Seema Verma with CMS, Admiral Giroir with the U.S. Public Health Service, Dr. Steve Hahn of the FDA, and others represent a level of commitment.
Yeah, you could see on the wide cam, they switched Pence on in the back right before he came up.
Thank you for your gracious words. That White House Coronavirus Task Force met today. It was reported to us that at this moment, more than 746,000 Americans have tested positive for the coronavirus. Unfortunately, more than 68,000 Americans have fully recovered. But sadly, more than 41,000 Americans have lost their lives to the coronavirus. And we always want to express our deepest sympathies to the families in their loss, as well as to all the families who have loved ones that are struggling with this disease. Today, we've seen encouraging news again about our progress as a nation. President Trump reflected on those momentarily, but the Coronavirus White House Task Force today learned that our large metro areas continue to stabilize and even see progress. The New York metro area, including New Jersey, New York, Long Island, Connecticut, and Rhode Island, all appear to be past their peak. The Detroit metro area also appears to be past its peak and is stable. New Orleans metro area actually is the most stable of all areas where we had a major metropolitan outbreak. And the Denver metro area is stable. We're dealing in Colorado with a meatpacking plant issue. And of course, California and Washington remain low and steady. Areas that we continue to watch carefully on the task force include the Chicago metro area, Boston metro, and the Philadelphia metropolitan area. The progress that we are making is a tribute to the American people. It's a tribute to state and local leaders in all of these areas and the partnership that our president has forged. But we just want to encourage every American as we see this progress to continue to heed your state and local authorities. I think the American people know no one wants to reopen America more than President Donald Trump. But I want to assure you we're going to continue to work with governors of every state, with the president's guidelines for opening up America again, and we're going to work in a way that we can consolidate the progress that we have made and help move our states toward reopening our country. We also received a report today, and the Coronavirus Task Force, at this point, 5,528 military personnel have been deployed across 24 hospitals and facilities, and 28,700 National Guard are on duty. On the subject of supplies, the President spoke about this at length, but at the present moment, we have more than 9,000.
I just faded Pence all the way out, and I wanted to see if anybody even noticed. This man is so boring.
To the strategic national stockpile. As the President mentioned, our air bridge continues to work. 64 flights completed, 50 more flights on the horizon, literally bringing in medical equipment from around the country and around the world and deploying it to critical areas. Finally, tomorrow, as the President announced, we'll be hosting a conference call with all of the nation's governors, all the states and territories.
Pence said that
from the headquarters at FEMA.
New York is stable, the most stable of our metro areas. They have 6,100 new coronavirus cases yesterday.
And evaluate the President's guidelines for opening up America again. the criteria that we believe is appropriate and necessary before states
Patricia,
can move
I just
into
hope
any
this whole
phase
thing
one
ends at some point,
change
because I need to
in
come
the
eat your food.
mitigation strategies, but also at the President's direction tomorrow. We'll be providing all the nation's governors and all of their health officials with detail about the testing infrastructure that exists all around the country.
You're welcome, Fernanda.
We'll be specifically providing governors and state health officials with information about all of the lab capability that exists in their states, and also we'll be updating them on our efforts to identify the kind of supplies the President just held up, and our efforts to make sure that those supplies are at all of those.
He admitted it. The President held up the supplies.
Remember that a month ago we had done 80,000 coronavirus tests in America. This weekend we cleared more than 4 million, and we're currently testing more than 1 million Americans a week. We fully expect to actually have tested more than 5 million Americans before the end of this month.
But you should have been testing way back when it counted, like South Korea did. That's the whole point. It's late now. That's why we shut down the country. South Korea never shut down the country.
Will most support their efforts to move their states forward. Remember that the testing that is contemplated in the guidelines for opening up America again for phase one are testing people that have symptoms that may be coronavirus, and then also having the testing resources to deploy to vulnerable communities, nursing homes, or other vulnerable communities that we have identified as needing additional what is called monitoring or surveillance testing. We believe we have the testing today around the country that would allow any state in America to move into phase one if they've met the other criteria: 14 days of consistent declines and strong hospital capacity, so that the system would not be overwhelmed in the event.
I had to get a snack. I couldn't
flare-up.
take it anymore.
But we're going to be working with governors tomorrow on the subject of testing and supplies. And as the President said again this evening, we're here to help. We've forged a partnership with governors around the country, and tomorrow we'll be building on that partnership to hopefully arrive at the day that we can make sure governors around the nation have the best advice and the best resources to put America back to work. Thank you, Mr. President.
Very good. Seema, you've done such a great job. Please come up and say a couple of words. Thank you.
Thank you, Mr. Vice President, Mr. President. So just a few weeks ago, we stood here and asked the American healthcare system to delay elective surgeries and procedures. And the reason why we did this is we wanted to make sure that the healthcare system could deal with any surges. We wanted to preserve equipment, make sure that they had the appropriate workforce to handle any surge. And our healthcare system did a fantastic job. They very quickly stood up telehealth services, and under the President's leadership, we started paying for these services under the Medicare program.
You know how everyone's making masks? I'm gonna save some lives right now.
Surgery for breast cancer, somebody who has cataracts in their eyes that need to be able to see better, and sometimes a doctor just needs to be able to listen to their patient's heart. We've heard across the country that doctors' offices have closed, and many healthcare systems are furloughing their staff, nurses and doctors. Under the President's leadership, we've put out over $90 billion in accelerated payments under the Medicare program, provided $30 billion of grants with more dollars on the way. But thanks to the American people, we are in a much different place. You heard from...
Boom. You're welcome, America. 2 Q-tips and some Scotch tape.
Unused capacity.
I hesitate to use the word hero,
Issuing guidelines today about how we can reopen the healthcare system. So these are recommendations around phase one. Now, every state and local official has to assess the situation on the ground. They need to make sure that they can still address surges. They need to make sure that they have adequate supplies and a plan for conserving supplies. They need to be able to screen patients and healthcare workers for COVID virus. And they need to make sure that patients feel safe when they come in to seek healthcare services by assuring that they have the appropriate cleaning in place and that they observe social distancing inside the healthcare facilities. And this isn't going
And
to be like a
that
light
they're
switch.
covered.
It's more like a sunrise where it's going to be a gradual process. And healthcare officials across the country and healthcare systems need to decide what services should be made available.
Is the tape sterile?
And ultimately, doctors and patients need to make decisions about their healthcare
Seems like
services.
it.
And we want to make sure that systems are reopening so that they can stay open and doing that in a very measured way. And I want to thank all the healthcare workers on the front lines have done a fantastic job in
You're
providing
welcome.
care and comfort, serving as a liaison between
And
family
swabs.
members. They've done a fantastic job, and we owe a debt of gratitude to them. And to
Oh,
all those
stop.
providers that did adhere to our guidelines. They did the right thing, and it has made an extraordinary difference. I also want to take a couple of seconds here to talk about our nursing homes. Our hearts and minds are with the patients and the families of those living in nursing homes. This is an extraordinarily difficult situation. People living in nursing homes are of the most vulnerable patients. They're elderly. Many of them have underlying health conditions. And this has been a very hard situation. And I really appreciate the strong efforts of governors and local communities that have shown great leadership in supporting nursing homes across the country, particularly Governor Baker, Governor Hogan, that have had special efforts around supporting nursing homes.
What besides your
FEMA's
hearts and
also
minds
working
are
on a
you
plan
doing
to
for
make
the
sure
old
that
folks'
nursing
homes?
homes have the supplies
Hearts
that
and
they
minds
need.
are not enough.
And just last week, we increased the reimbursement in the Medicare program for high throughput tests. And we are also paying for labs to go out to nursing homes to collect samples. And that's going to really support efforts on the nursing homes in order to isolate patients. Today, we are also announcing
if
under
you guys
the
need any
President's
swabs.
leadership an effort around nursing home transparency. It's important
They
that
come in a
patients
variety of
and
colors.
their families have the information that they need.
And I've got
they need
nothing
to
but
understand
time.
what's going on in the nursing home. And so today we are announcing that we are requiring nursing homes to report to patients and their families if there are cases of COVID virus inside the nursing home. We are also requiring nursing homes to report directly to the CDC when they have cases of COVID virus. And this is very important, as you've heard Dr. Birx talk about.
How is that
as
not
we
a thing
reopen
already?
The United States, our surveillance effort around the COVID virus will also begin in nursing homes. And so by having this reporting system, this will support CDC's efforts to have surveillance around the country and to support efforts around contact tracing so that we can mitigate the spread of the virus in those communities that show spread starting in the nursing homes. So again, I want to thank all of the local officials that have done an amazing job in supporting the nursing homes and would urge all state and local leaders to follow their lead and do everything that we can to keep nursing home residents safe. Thank you.
Thank you very much. And
he used a
Dr.
serious
Hahn
voice
is
here. He
here.
always
You
does.
need,
Thank you very
he'll
much.
tell you maybe a little bit later if you want this, but I can tell you that very simply, the level at which they're approving tests, and being on top of the people that are doing the testing for therapies and for vaccines has never.
Have fun with your
they've never seen
dogs. I
anything
wish I
like
could
this.
join
So
you.
I want to thank you very much, and stick around. Maybe they'll have some questions.
Ms. Pamoon.
Please go ahead.
Questions.
Questions. Thank you very much. If there were groups of people planning to protest tomorrow against the government shutdown, what would be your advice?
Against the shutdown?
Yeah, that they want the shutdown lifted. Should they go ahead if it's a state where there haven't been 14
I don't have
days?
any arrested. People feel that way. You're allowed to protest. I mean, they feel that way. I watched the protest, and they were all 6 feet apart. I mean, it was a very orderly group of people. But you know,
No, you did
some
not.
have gone too far. Some governors have gone too far. Some of the things that happened are maybe not so appropriate. And I think in the end, it's not going to matter because we're starting to open up our states. And I think they're going to open up very well. We're going to be watching it. We're going to be watching it very closely. We're working with them on testing. We're working with them on whatever they need. I don't think they need ventilators anymore. I believe the term the governor used was phenomenal. We've done a phenomenal job. That was the term that was the only sentence they left out, which is okay. But I appreciate that that's what Governor Cuomo said. But they've done a phenomenal.
He's still on it. He's still upset that they didn't show Cuomo saying that he did a good job.
Protesters, I see protesters for all sorts of things, and I'm with everybody. I'm with everybody. Please, in the back. Go ahead.
I'm gonna show you a bunch of protesters being 6 feet apart
You ready? Yeah.
right now.
Please, thank you, Mr.
See if I can pull that in.
Yesterday, you pointed out that Iran was likely not truthful in the reporting of the virus. Meanwhile, Senator Dianne Feinstein and other Democrats are looking for $5 billion in aid to Iran. Are you considering giving any aid to Iran?
If Iran needed...
Oh,
aid
she's with
on this,
OAN and
I would
she's
be
standing
willing
outside of
to
the
do
room.
Something if they want it, if they ask for it, I would be certainly willing. They were hit very hard. Obviously, those numbers weren't correct numbers that they reported. But if they needed help, if they needed aid, if they needed ventilators, we have thousands of ventilators
So
currently on hand,
OAN
and
is part
ventilators
of
under construction
the White House
under,
Correspondents
that are
Association,
under construction.
but
That's
they
mosquito. I
wouldn't
don't like
listen to the
mosquitoes.
6-foot rules. They kept showing
I
up
don't
on
like
days when it
mosquitoes
wasn't their
at all.
turn, and they stand in the back, and
But,
that's exactly what
if
she's
they,
doing.
Yeah, we would certainly be willing to help.
So you can see her standing in the
What they should
hallway,
do is
and
be
Trump
smart and make a
always
deal.
calls on them,
It's only because of
even though they're violating the
you know, you
social
look at
distancing
what
rules.
happened, it's
Because,
John
you
Kerry,
know,
I guess,
Trump.
just doesn't want them to make a deal, and they're probably figuring they can wait, and maybe it will be Biden, and they'll own America if Biden gets. And they know with me, it doesn't work that way. It doesn't work that way. If Joe Biden got in, they'd own America. Between them, China, Japan, Mexico, Canada, they'd own America. You wouldn't have a country left if he got
Wait,
in.
how much of America does Canada
Go ahead,
get?
please.
Can we have California, Washington, and
First
Oregon,
question, you mentioned
and
you've
Hawaii?
seen some governors, I think you said this yesterday too, that some governors you think have gone too far. Which governors are you referring to, sir? Which states?
I don't want to mention names specifically, but
He doesn't know
obviously,
that woman in Michigan's
one we
name.
can mention that's this, but really much beyond this is Virginia with what they've done on guns. He is playing with your Second Amendment. We can't allow that to happen, and that is indirectly related to this because you know what's happened with guns. People are buying guns at a level that you haven't seen before because of this surge of plague. So what he did was totally
Yeah, you
inappropriate.
got to shoot the
Other than
plague.
that, I'm not going to mention
If it
governors,
comes at you,
I
you
have a
have
list.
a
1,
full
2,
right to
3,
stand
4,
your
5,
ground.
6, 7.
On money, sir, you mentioned off the top that you hope that a deal may come tomorrow on the small business loan program.
Well, I hope so.
But, you know, this morning Mnuchin seemed like this was ready to go. It seemed like any second now. Is there any changes there?
You know, every time you say it's ready to go, then they say, oh, we have a good negotiating position now because he just said it's ready to go. So now, let's see what happens.
That's how Steve
But,
Mnuchin
we
talks.
wanna put
It's
our-
ready
we
to
wanna take care
go.
of our workers.
It's
We want to
right.
take care of our small businesses. They're really the engine of this country. We have to take. When we open, we want to have those small businesses ready to go. We don't want those businesses.
I know, Chris,
abandoned
that's sad.
because they couldn't afford. their
Fewer kids are
employees, they
dying in
couldn't take
America
care- and I
because
wanna
there's
take
no
care of
school
those
shootings.
employees.
Well, what's the holdup now, sir? Just in terms
I can't tell you that. I can just tell you that we're negotiating with the Democrats, and you know they negotiate for things that we can't do, that we don't think are in the best interests of the people of this country. We are very close to a deal. I can't tell you whether or not we're going to get the deal or not. Who would say that? You want me to say we're going to have a deal before we have a deal? We have a good chance of getting a deal. A lot of good discussions were had today. We have a good chance of getting the deal. We want the deal. We want to take care of our workers. We want to take care of our small companies. Go ahead, please.
Thank you, Mr. President. I have a question for you and also for Dr. Khan, if I may, after I get to your question. In your remarks that you made just a few moments ago in regards to reopening the U.S. economy, you said...
He looks like a
"I wanted to
1940s
be
reporter,
safe,"
though,
and
doesn't he?
That's a sentiment obviously shared by tens of millions of Americans.
I wanted to be safe.
And it seems at odds, Mr. President, with the tweet that you had on Friday about liberating those 3 particular states, Virginia, Minnesota, and Michigan, because none of those states, Mr. President, have met the requirements that the Vice President and others on the task force have talked about in terms of reopening the economy.
Oh, John.
Well, if you take Michigan, there were things in the Michigan that I don't think they were necessary or appropriate. Everyone knows that.
What's
I
her
think the
name?
governor
Say
of
her
Michigan,
name.
We're getting along very well, but I think the governor of Michigan probably
woman?
knows that. I think she probably wished she didn't put some of them in. You can't buy paint. You can't buy seeds. I mean, where did this stuff come from? No. We're going to be safe. We have to be safe. And we don't want to
You
close
can't buy
anything. We're not
exterior
gonna be
paint for your
closing.
house because they
But we're
don't
gonna be
want
doing
you
it beautifully,
outside.
systematically. We're working very well with the governors. I mean, I would say pretty much almost all of them. A couple of them, no matter what you do, you'll never satisfy them. You could find the cure tomorrow, and they wouldn't be satisfied. They'd find a reason to complain. Wise guys.
I'd be totally satisfied with the cure
For the most
tomorrow.
part, we're working very well with the governors. We have a great
I would
relationship
complain that
with
we
the
had to
governors.
lose 42,000
I can
people
tell
because you
I've been
didn't
on numerous
test.
calls with governors, and during those calls, I mean, without exception, they were friendly, and that's going back even a month from today. So I think that we're going to do a terrific job. I think the governors are going to do a terrific job, and we're starting to open our country. And as you know, I just
Everything
spoke
is
with
awesome.
Greg Abbott today from Texas.
Everything
He's
is cool
fantastic.
when you're a
He's
part of a
fantastic governor.
team.
And he's going to be opening up parts of Texas, and you're going to be opening up parts of other countries. You know what other states, and you know what that is.
Oh.
And by the way, other countries are at a point where they're studying. I see where
Right, 'cause he
Germany's
didn't make a
starting to
mistake.
Open up a little section. So there are a lot of great
Yeah.
things happening, and we're going to start to open
It's super
our
great.
country, and we're going to do it. It's like, as they say, it's like a beautiful puzzle. The state,
As they
might
say,
even be
he
a
said
portion
that.
Of a state. There are states, very big states, and you can have portions of states, Mike. You have a portion, you have a county which is perfect, and you have another county that's sort of still pretty far away, even if it's within the same state, and it's not doing so well. But they may open up parts. So we're going to do it very, very carefully, and I think it's going to be very successful. But when you say safe, I want it to be very safe.
Every single state has hundreds of cases.
Go ahead, please.
Thank you very much, Dr.
Every
Hahn.
single state had new cases yesterday.
There's a question that I don't know the answer to, and I was hoping that you could provide an answer to. There's an epidemiologist at the University of Alabama in Birmingham who's actually a COVID-19 survivor, and his name is Michael Say. And his question is this: why would the virus suddenly be different? And why would people's susceptibility be any different on May the 1st, or on June the 1st, or on July the 1st? And this all relates to reopening the economy. Can you explain or give an answer to that particular question?
I don't think we have evidence that one would be more susceptible or less. What I think we can say is that the mitigation efforts have really helped with respect to this, and that what we've seen is the number of cases have gone down. And if we follow the gating criteria for the opening, we're then able to institute phase 1 and have the appropriate measures in place to actually reduce any chance of flare-up of the cases.
Is there a chance of a sort of rebounding if you reopen too soon without the type of mitigation efforts that we've had still in place?
Yes, there's a chance. And I think Dr. Fauci and Dr. Birx talked about this at the podium. And the key here is the surveillance that is being put in place with the CDC. I think that'll be a really great help in terms of trying to reduce that risk. Thank you.
And I think they have the rest of that clip. I just thought it was a very good clip. I think it's
They're
a
going to
tribute
show the
New
clip.
York. I think it's a tribute
He
to
has
the
to show the
federal
clip
government.
because they say nice
And I thought it
things
was nice. So I think
about
they
Trump.
have that now. They can try it. Go ahead.
He left, and it has to be shown.
We
This is
saved
so
everyone,
Trump.
no. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system.
Okay.
Mr. President, you had called on me.
Yes,
Thank
I
you.
did.
I appreciate it. Since you shared with us something else that you saw on TV today, I have a question about something you said
Come on.
on Thursday, which is that you were angry because information about the virus should have been told to us earlier and a lot sooner. People knew it was happening, and people did not want
What
to
is
talk
happening?
about it. Many Americans are saying the exact same thing about you, that you should have warned them the virus was spreading like wildfire through the month of February instead of holding rallies with thousands of people. Why did you
Oh,
wait
he's
so
not gonna be
long
happy.
to warn them?
She's nasty.
And why did you not have social
Who
distancing
you with?
until March
Who
16th?
Who are you with?
I'm Weijia Jiang with CBS News.
So
Okay, so that's one of the worst.
If you look at what I did,
That's fake.
in terms
Right
of
there. You're fake.
cutting off or banning
China.
from coming in.
Chinese nationals. But by the way, not Americans.
Oh,
who are
she's
also-
good. I love her.
Nice and easy. Just relax.
Marry me. Nice and easy.
We cut it off. People were amazed. These gentlemen, everybody was amazed that I did it. We had 21 people in a room. Everybody was against it but me.
It was 35
Dr.
people, then it
Fauci
was
said,
19.
Had I not done that, perhaps
Now it's 21.
tens of thousands, and maybe much more than that, people would have died. I was very early, very, very early. And we just saw, you saw Brett Baer making a statement. They had a debate well into February. And not even mentioned, it wasn't even mentioned, the Democrats. We were very early. Oh, I'm
MSNBC didn't take it up?
And you know what I just did?
So quickly.
And you know what I just...
And by the way, when you issued the ban, the virus was already here.
Okay, and you know how many
That's
people
right.
when I issued the ban? How many cases of virus were in the United States when I issued the ban? Do you know the number?
We have no idea because you weren't testing.
No, how many cases? Remember I said one person. How many cases were here when I issued the ban?
But
Tell
did
me.
you know?
No, you have to do your research. How many...
I did my research. On the 23rd of March, you said you knew this was going to be a pandemic.
Can I tell you what?
well
I did
before-
know it. I did know it. All I have to do is look.
So you knew it.
Anybody knew it. Just, are you ready? How many cases were in the United States when I did my ban? How many people had died in the United States?
So do you acknowledge that you didn't think
Keep your
it
voice
was
Zero.
down, please.
spread?
Keep
No
your voice
people
down.
had
Did you
died.
not-
How many
Keep your voice
how
down.
many cases were in the United States? I did a
Wow.
ban where I'm closing
He's
up
America's
the entire
dad.
country. How many people died?
And that's a fair point.
How
He didn't
many
close up the
people
entire
died in
country.
the United States, and yet I closed up the country.
41,000 is the
And
answer.
I believe there were no deaths, 0 deaths at the time I closed up the country. Nobody was there. And you should say thank you very much for good judgment. Go ahead, please.
You just mentioned Germany. Germany is allowing small...
Come on, next reporter, follow up.
I just spoke to
Does this give you confidence that some European countries are on the mend of recovery?
Well, I hope so.
I'm gonna marry her, not her.
Will you lift some
I spoke with Angela, and they're going to start a process of opening, very much like we are. We are too. I spoke with numerous governors. They're doing it also. Areas that have been, where number one, they've done a good job, and where they don't have much of a problem. Germany's starting the process also, yes, and I'm very happy about that. Some places in Europe, as you know, can't start the process for a while.
Mr. President.
Yes, ma'am, go ahead, please.
Mr. President, I have two Nevada questions. First one, the mayor of Las Vegas thinks it's total insanity for business to be shut down in Nevada, which the governor Sisolak ordered. Who's right?
Well, they shut one of my hotels down, too. Okay, so, you know, now I'm not involved in that. I could be if I wanted to. I just chose not to be. By the way, just so you know, I could be if I wanted to, but I chose not. But they closed a very big hotel that I have in Nevada down in Las Vegas.
Nevada.
It's a very severe step he took.
Anybody watch Veep?
I'm okay with it. I'm okay with it. But, you know, you could call that one either way. I know the mayor's very upset with it. Some owners are very upset with it. Some of the developers out there are very upset. Others, they say, hey, we got to get rid of it. I can see both sides of that.
Nevada had 3% growth yesterday in cases,
I
just
asked you
in one
recently
day.
about an SBA rule that said that paycheck protection money could not go to small casinos. You said you'd look into it, and clearly something
They
happened.
are
Oh, hey,
looking
Sarah.
into it right now because they do have, you know, they have small casinos that don't have too many people, and they are looking, and they're going to make a ruling, I understand, next week.
They already did make a ruling, and they changed it from small casinos that make
Yeah,
more
everybody,
than a
if you can
third
get HBO for
of their
free,
income
which they're
could
doing
be
right now,
qualified to have
watch
it.
They're
Veep.
looking at that. They're continuing to look at that. It's a big topic because a lot of people involved. Let's give it a shot.
Thank you. You know, Governor Cuomo, as you played in that clip, has
Let's give it a
praised
shot.
A lot of what the federal government has done, but he.
Oh, God, let's give it a shot.
He didn't say a lot. He said we did a phenomenal job. He didn't say a lot. He didn't say you did a good job on ventilators but nothing else. No, he said we did a phenomenal job. So report accurately because you are one of the most inaccurate reporters. Go ahead.
What he has said is that, and along with a bunch of Republican governors who've said what they need, though, is a national strategy when it comes to testing. Because on supplies, they say that they're competing against one another.
They said the same thing with ventilators, and now we have so many that we're going to be able to send them and help other countries that are in need. We're doing
Okay,
great
but
on
testing.
and we are actually using the act, as you know, on a certain company.
But what about on the reagents? They say that that's something that they can't
We're
get.
in great shape. It's so easy to get. That reagents and swabs are so easy to get.
Literally every governor
When
on
you have to
television this
build
morning
a
was saying
very
we can't get the
expensive
reagents,
piece
we can't
of
get the swabs,
machinery controlled
which if
by
you're just joining
computers,
us, I took
that's
care
a
of that
different
already.
thing. And,
Problem solved.
No, we'll have everything's going to be in very good shape very soon. We're going to be in very good shape very soon. Yeah, please go ahead.
You can do this yourself at home.
Just the latest stimulus package, will that have funding for states and local governments? Mr.
Well, I don't want to comment on it, but we will be saving that for another time.
Will you be willing to...
And by the way, some states and local governments need it. I'm the first one to admit that. We're going to be saving that for another little bit of a later date. Will probably be our next negotiation.
Okay.
But they do, I'm in favor of it, I will say. And I told the Republicans today, I had, I think, a great talk with Republican senators today. And all of them, I think, just about all of them. And conference call. And we are going
Not
to
Romney.
That'll be a very big topic over the next couple of weeks. It's very important.
And what is the administration doing to make sure that,
Watch now,
hotel
there'll be a run
chains
on tape.
And hedge funds...
Well, that's another
All the tape
way.
everywhere will
That's
be sold
another.
out.
We have hotels that are big, massive buildings that are under-levered, but if you have no income at all coming out...
Under-levered? Is that a word?
These hotels are, they go from...
Isn't it
under-leveraged?
under-leveraged?
They have to be closed down. It's a terrible thing. I don't know that they're working on that specific problem, but it's a problem they should be talking about. I mean, you have people that own a hotel where they go from having a very successful hotel with, many
So here's
employees,
Mr.
thousands of
Businessman,
people,
Mr. Successful Builder,
all of a sudden
Mr. I have
closing
all
it
these
down.
hotels.
I read where
And
my wonderful
under-levered,
place in
under-levered, I
Florida,
can't even say it.
Miami,
Under-levered is
Doral,
not a word
they had
according to
let
Google.
A lot of the employees go because it's
Under-leveraged is a word.
You can't
Nor
use it. You can't have the
does he
restaurants,
explain
you can't
who's
have
the
the-
beneficiary
you
of
have
the
to close down.
under-levered
That's
hotels.
an example. Many hotels are closing down throughout the country, and hopefully they're going to be able to open up
Because they're
really
under-levered.
quickly.
But the funds were specifically for small businesses. Would the administration
Well, it depends
make sure
how the
that
hotel is considered.
Why doesn't a reporter just look at him and say, what are you saying by under-levered? What does that
200
mean?
Hotels in the country, and they're closed. And it's not only in the country. Remember this. This is all over the world. They could have 2,000 hotels that are in other countries. They're also closed. We're in better shape than most when you think about it. So I think we're going to be looking at it. I
41,
think it's a very big
42,000
problem.
dead.
And it's a lot
Super
of people
shape.
employed. Yeah, here we go.
Mr. President, more than
Oh, here
22
we go.
million Americans are currently unemployed as a result of this. Today we hit the grim milestone of more than 40,000 Americans now having died
that's
from
CNN.
the coronavirus. Can you
Mr.
explain
Diamond.
then why you come out here and you are reading clips and showing clips of praise for you and for your administration? Is this really the time?
an excellent
for
question.
Congratulations.
Well, I will tell you this.
It's
what I'm doing
always the
is
time.
I'm standing up for the men and women that have done such
Name
an incredible
Trump.
job. Not for me, for the men and women, admirals, vice president, if I might, but all of the men and women, thousands, tens of thousands of them that built hospitals in New York and New Jersey and all over.
Literally the
this country
title
in
of the
record
article that he
time.
read,
Throw up
Trump
1,000 beds in
rewrites
4
the
days.
book on
I'm sticking up
emergencies.
for those people. Those people
All the
have
men
been
and women,
incredible. I'm also
all of them,
sticking up for
named
doctors
Trump.
and nurses and military doctors and nurses.
The clips that you played and what you read earlier was praising
He's putting
you
on a
and your
concert.
All I played today was Governor Cuomo
to do that, sir.
saying very positive things about the job the federal government has done.
On this
And
day,
those people
40,000
and
Americans have now died.
those people have been just absolutely excoriated by some of the fake news, like you. You're CNN.
No,
you're fake news.
no one is
And let me just tell you,
excoriating the
they were
doctors and nurses.
excoriated by people like you that don't know any better, because you don't have the brains you were born with. You should be praising the people that have done a good job, not doing what you do. Even that question. So just so you understand, if we didn't do a
The question is
job,
why now, not why are you doing
I'll tell
it.
you why
Trump
now.
is insulting
Are you
someone's
ready?
intelligence.
Because these people are right now
You ready?
in
He does that.
hospitals. It's dangerous. It's going to a battlefield. And I want these people, I want you. I want you in the...
sir. This wasn't about
It's all about that. It's not about me.
your administration.
No, nothing's about me. Look. you
Trump
never
rewrites the
treat
book
me
on
fairly,
emergencies.
Many of you. And I understand that. I don't even know. I got here with the worst, most unfair press treatment, they say, in the history of the United States for a president. They did say Abraham Lincoln had very bad treatment, too. Let me just tell you.
It has your name in it. It talks
Honest-
about Trump
honest, Dave.
making the playbook.
Well, that's a positive thing, because that's an exercise in how to do it and what to do. And that's good for the future. People can learn from
Diamond
that.
bringing the
But
facts.
I want the men and women of this country that are in danger, the admirals and the generals that have done a job like they've never done before. They're in war. We're in war. I call it the invisible enemy. That's a war, and it's a dangerous war. We're also at a level, when you said 40,000 people, and you're right, almost 40,000 people. And what?
No,
more than
40,000 people.
Correct me.
41,000.
Good. Well, I'm really glad you corrected me, CNN. But here's the story.
Yeah.
Let me just tell you something. If we
Because
didn't do
they're
what we
dead
did,
Americans.
40,000 right now could be 1 million people. Could be 1 million people, not 40,000. It could be 1 million. We're tracking at much less than the lowest possible estimate, and that's a great tribute to a number of people and a number of things. One of the things that it's a tribute to is
Then why
what's
read the
taking
article
place
called Trump
in this country with
rewrites?
the American people, because they've gone inside, they've done it.
That's a good point, Sandy. It's a war he lost 3 months ago.
And in fact, when they did the models, as they call them, nobody thought it was possible. They did models,
Because they're
not
models.
based on this kind of success. I've seen New York streets, and I see it in the morning. I've watched all my life New York streets.
And they're empty?
And you can't even see the pavement. There's so many people. And you take a look this morning, you take a look, even on Friday morning, I looked at it, I saw it through a camera. There wasn't a person on Fifth Avenue, there wasn't a person on
There wasn't a
Madison
person
Avenue.
I
I've
could
never seen
shoot on
anything
Fifth
like that.
Avenue.
Because
I could have
people
just
have
fired at
really
random, not hit
listened to
anyone.
instructions, and they've listened to what we've had to say, and the professionals, they've listened. And those people should really give them a lot of credit, including people like you, because you just don't have the sense to understand what's going on. All right.
Well, he doesn't
Please
have
go
the
ahead.
brains he was born with. At some point, they were removed.
Companies like Shake Shack and Quantum Corp and Roost Chris, should they have access to the PPP program?
Well, it would depend. It would depend. A lot of those, I don't know much about any of those companies, but a lot of times they're owned by franchisees where they own one or two places, and they are small businesses. So a lot of that would depend on what the formula is. But again, many of those companies are, they're out to franchisees. A franchisee could open up one of the places that you mentioned. And so, yeah.
He
I
can
would
see
say
them from
that's
the
important.
penthouse,
Actually, that's like a
Chris, with his
restaurant.
scope.
Go ahead, please.
These, you referred to these protests earlier. Some of them are getting pretty intense, and we're actually getting some death threats and some governors who are reluctant.
You are in the media?
No, the governors are getting death threats. Governors of Kentucky, Michigan, Virginia, they're getting increased levels of death threats. And are you concerned that you're talking about liberation and the Second Amendment and all this stuff? Are you inciting violence among the few people?
I've seen the people. I've seen interviews of the people. These are great people. Look, they want to get. They call
Great
it
people.
cabin fever. You've heard the term.
Oh.
They've got cabin fever. They want to get back. They want their life back. Their life was taken away from them. And they learned a lot during this period. They learned to do things differently than they have in the past. And I hope we're going to be sitting next to each other in
sorry,
baseball
folks.
games, football games, basketball games, ice hockey games. I hope we're going to be sitting next to each other. I hope you have
Yay,
golf.
hockey.
The Masters is going to have 100,000 people, not 25 people watching at the course. I am not. No, I'm not. I think these people are. I've never seen so many American flags. I mean, I'm seeing the same thing.
So
that you're
close
seeing. I don't see
together.
it any differently.
There too.
They're who?
Nazi.
Well, that I totally would say no way. But I didn't see that. I see all. Of course, I'm sure the news plays that up. I've seen American flags all over the place. I have never seen so many American flags at a rally as I have in these rallies. These people love our country. They want to get back to work. Please go ahead.
Have you thought any more about pardoning Paul Manafort or Roger Stone so they're not exposed to coronavirus in jail?
Well, I just tell you this. Roger Stone was treated very unfairly. Paul Manafort, the Black Book, turned out to be a fraud. We learned that out during the various last number of weeks and months. They had a Black Book that came out of Ukraine, turned out to be a fraud. Turned out to be a fraud. They convicted a man, turned out to be a fraud. General Flynn.
That's a right-wing
was a
conspiracy, by
highly
the way.
respected person, and it turned out to
David,
be
with Snopes, if you're still
a
on here, do you have
scam on him.
something to say about the
FBI said
fraudulent
he
black
didn't
book
lie.
that Manafort had?
And Mueller's people wanted him to go to jail. Okay? So what am I going to do? You'll find out what I'm going to do. I'm not going to say what I'm going to do, but I will tell you the whole thing turned out to be a scam, and it turned out to be a disgrace to our country, and it was a takedown of a duly elected president, and these people suffered greatly. General Flynn.
It wasn't a
What they
takedown.
did to him. And even the FBI said, and they had some, and nobody bigger fan of the FBI than me at the level of the people that really matter. But the top of the FBI was scum. And what they did to General Flynn, and you know it, and everybody knows it, was a disgrace.
I don't know it.
He was in the service for over 30 years. He
lied to them.
General and respected. And almost his first day in office.
And Obama fired his ass when he was director of national intelligence because he was terrible.
Before, and now the tables
and
are
Obama
turned.
warned him. Warned you about him.
Investigators, I guess. These were crooked people. These are bad people.
We need to
These are very
investigate the
dangerous
investigators'
people.
investigators.
You know what they are, though? They're scum.
Scum?
They're human scum.
Yeah, I knew it.
Have one in the back, please.
Thank you, Mr. President. The CDC has finally admitted to profound failures with testing kits from the beginning.
Oh, OAN again.
Is this a function of lax oversight from the Obama-Biden administration?
Well, it's not from me. I mean, they came in and they had some problems early on, but we've straightened it out. But yeah, look, I told you we inherited a lot of garbage. We took, they had tests that were no good. They had, all this stuff was no good. It came from somewhere. So
there was no test for the coronavirus during Obama because there was no coronavirus.
Having a lot of bad things
COVID-19. They had the first 18 COVIDs.
They're doing a very good job now. But no, initially, look, our stockpiles were empty. We had horrible stockpiles. We had horrible ventilators. We had very few of them, too. And so did the states have very few of them.
Horrible ventilators.
But all of these things are now we're at a level that we've never been. Same with our military. Our military is the strongest it's ever been. We spent $1.5 trillion on our military. We've totally rebuilt our military. It's never been in a position. We even have
showing
Space
Panda
Force.
how to test
Mike
for
and I
the
were talking
coronavirus.
about what an achievement that is. First time in 72 years we have a new force. So, yeah, CDC had obsolete tests, old tests, broken tests, and a mess. But they've done.
America's sorry about the coronavirus, but Space Force,
so we're very proud.
Carbon
of the job
neutral.
they've done. Please go ahead.
Mr. President, you said swabs are easy, and
they are. He's absolutely right.
There are shortages for more than a month now. Why wait till use the
Yeah.
Defense Production Act until now?
Well, we already have
Shortage, longage.
One company that we're forced to use it with.
You're welcome,
And
America.
Probably by tomorrow we won't be. You know, it's a tremendous hammer. Probably by tomorrow it won't be, but we have millions of them coming in. They're very easy by comparison. And in all fairness, governors could get them themselves. They really could. All of this. But
Yeah,
we're going to do it.
at
We're going to
CVS.
work with the governors, and if they can't do it, we're going to do it. If they do it, we can do it maybe cheaper, better. We're going to get we're getting very high quality. With us, it's all quality too. Even if it takes a little
On
bit
Twitter,
longer, we
Bev
have the
just keeps
highest
saying
quality in all of it,
swabs.
including the
Is
ventilators.
she, are you guys playing a drinking game?
We have millions of them coming in very soon.
I get it.
And many of them already have been ordered, and the governors.
Apparently, some people are playing a drinking game where if you say swabs or swabs or swabs, you take a drink.
Mr. President, I'm President Xi.
Give me your location. I'll send 911 your way because you're going to poison yourself.
In this crisis and how it put the United
it's diamond again.
Based on an investigation, we're going to find out. Yeah.
So when you repeatedly praised Xi in January and February, you said he will solve the problem. You said he was doing a great job. Were you duped by President Xi?
No. I made a deal that's phenomenal for the United States. No, you know who was duped? You and the Obama administration were duped for years because China was ripping off this country like in the history of any country. Nobody's been ripped off like the United States by China and many other countries. And we stop it. And
In
we've
the history.
We've done a deal where they're paying us.
Like Rome didn't rip
$250.
countries
They are
off.
buying $250.
The Ottoman
They didn't do
Empire.
anything for us.
England.
We didn't even have a deal. It was so bad.
The deal. These comments.
No. It is about a deal. Because the deal started a long time ago before anybody heard about this. The deal was finished a number of months ago. Very happy. I was very happy. I hope they were happy. Billions of dollars came in tariffs. Billions of dollars. They're going to be purchasing billions. And then all of a sudden, long after that, I find out about this. And I told you, I'm not. Listen, CNN. Listen, CNN. I told you I'm not happy about it. And this was after the deal. So we have this wonderful deal. And I was nobody's been tougher before the deal ever on China than Trump. Then I made
Okay, we're
a
not
deal.
talking about that. Can you stay on
Very happy
task?
with the deal. It's a great deal, great for our farmers. The farmers have been paid a fortune already. Then what happened? no mistake. We
The
made a
farmers
great
have been
deal.
paid a fortune.
Now I find out after
Record
the deal,
bankruptcies.
after the deal, not
Ba-
after the
ba-
deal.
anyway.
I find out
Quiet, Kevin.
that I'm not happy. You people are so pathetic at CNN. Let me just tell you.
February 23rd.
Sure. I was very happy with the deal. Very happy with everything. Then we find out about the plague, right? The plague.
Yes,
And since
yes,
we found
right.
out about that, I'm not happy.
That's what he's asking
But I
about.
closed it up long before Pelosi. Listen, long before Pelosi, you know, she was having
Oh, it's about
parties
Pelosi.
in San Francisco. Let's all go
Parties.
to Chinatown. And that was a long time after I closed up the country. Go ahead, please.
So the first of the month is next week.
That's why your ratings are so bad, because you're pathetic. Go ahead, let's go.
CNN made $6 billion last year.
The first of the month is next week. So for people that are worried about whether or not they're going to see a stimulus check again next month, will there be another stimulus
Well,
check?
we're looking at it. We're talking about it. It's the delivery's been very good, as you know. People are getting them, and they're happy. It's
How much
saving
money
lives.
would it be?
We will let you know when it's appropriate, but we're not going to.
The checks are saving lives.
And you've seen that. By the way, you've seen that better than anyone, and you people have actually covered it.
How come he sees it better than everyone?
Yeah, okay, but you've seen what's going on, and we got those checks out to people. It saved their lives. Nobody else could have done it. Nobody else could have done it. And I'm very happy if we get this new check out to the workers in these small.
I guess if
essentially to
you're
the workers
completely
in these
broke and you can't
small
afford
businesses,
food and there's no
the
food
PPP,
banks
we are going to be,
and the state has no
we're gonna be
welfare
very
system,
happy, because as we open, those
it could save your
businesses
life.
will open along with us. Yeah, go ahead, please.
Mr. President, as you start reopening the country, do you plan to coordinate with Mexico and Canada to ensure that the U.S.
I
manufacturers
can see that.
have...
Sure. We're coordinating right now with both.
Oh, I
spoke
got
with
it.
President of
I got my
Mexico
check.
yesterday. I spoke with,
Panda didn't get her check yet.
Prime Minister of Canada, a lot, Justin, and we're
It was just direct
in
deposit.
very good coordination right now.
In terms of just the supply chain, as companies here
Yeah,
come online.
we're doing the supply chain. It's not going to affect trade. That's part of trade, and it's not going to affect trade. And if it does, I will tell you, if a supply chain based in Mexico or Canada interrupts with our making a big product and an important product, or even a military product, we're
Which
not
is
going to be
important?
happy. Let me tell you that. Go ahead, one or two more.
Oh, you're not going to be happy.
Go ahead in the back. You didn't
Okay,
go. Go
well
ahead.
that'll change everything.
I'm with the Salt Lake Tribune.
Okay.
Thank you, sir. On Thursday, the White House announced a congressional task force on reopening America. It included every Republican senator but Mitt Romney.
Yeah.
Does that show that you're still holding a grudge against
Yeah,
Mitt
I'll
Romney?
just, no, I'm not a fan of Mitt Romney at all. No, I had 52 Republican senators.
He was the governor. You don't
52 and a half.
I think, I'm not a fan of Mitt Romney. I don't really want his advice. Go ahead, please.
Mr. President, why on that task force did you include
Well, that was a wasted
Kelly
question.
Loeffler? There's some questions about whether she
Well,
may
because
have...
she's the senator from a great state, a state that I love, Georgia.
But there's some insider trading.
Well, I don't know. I really don't know about that. But she's a senator from Georgia, and she was
Controversy, and because it's a Republican controversy, I really don't know anything about that.
Yeah, Mr. President, you said you'd spoken to Angela Merkel and that the progress being made in Germany. You spoke about
many of the leaders, yeah.
Yeah, many of the countries that maybe have taken their eye off the ball and let coronavirus let rip in their countries. Which one were you talking about? The UK?
You mean some of the ones that didn't do well? I don't say that, but you just have to look.
Sweden.
And some of them
Just
just
say
got
Sweden.
hit hard. When I closed up our border, when I did the ban on China, they say a lot of the people that didn't come in here went to Italy. You heard that. That's why
No,
Italy was
Italy
hit
closed
so
their
hard.
borders completely
I don't
first to
think it
China.
was because of government. I will say,
Only Italian citizens could come
Italy
home.
has locked down
Trump's
probably more than any
proclamation
other
had
country right
11
now. It's
loopholes
just
in it.
absolutely locked solid down. But they got hit
Nobody
hard
went-
because people that were coming to the United States.
No
couldn't
Chinese
come
people that
because
were
I
like,
closed
let's
the
go to
country in
Disneyland,
January.
decided
They
then,
went to
oh,
Italy, they
let's
say.
go to the
It had to
Vatican.
do with trade.
Did
it
not
had to
happen.
do with the purchase of certain
Couldn't happen.
materials, and Italy was another alternative. And so many people
Bye,
went
Patricia.
to Italy instead of coming here, and Italy has suffered greatly. Now, I spoke with the Prime Minister.
No, that's
a lot. He's a great
complete
friend of mine,
nonsense.
And what's happened to Italy is very, very tough.
Italy
thank you all
shut
very
down
much. We appreciate
travel
it. We'll
from
see you
China
tomorrow. Thank you.
before Trump shut down partial travel from China to the U.S. Okay, well, that's it, I guess. Well, that was a whole lot of crazy. What time is it now? 5 o'clock? So, about an hour and a quarter.
C-SPAN has round-the-clock coverage
All right.
of the federal response to the...
Yes, you do, C-SPAN. Congratulations on that. Okay, well, hey, thanks for keeping me company, everybody. I think, oh my God, there's like still 15 people watching on Twitter. Thanks for hanging around and keeping me interested with the chats. If anybody else wants to say anything, I am about 30 seconds ahead of the chat. Oh, you're welcome, Sandy. I'll just stick around, let's see, 30 seconds, a minute and a half. I see your chat like 7 seconds afterwards, depending on what format you're watching this on. On YouTube, I think there's like a 3-minute delay. So if you're watching on YouTube, we're probably already gone. If you're not watching on YouTube, you can comment. Chris saying, yeah, now go drink. This was whiskey, Chris. That's all I've got left. You're welcome, Catherine. Thank you for saying thank you. Fernanda, thank you. Ramsey, I hope I'm saying that correctly. Thank you. Cash Dungeon. That's a cool name. Thank you very much. You're welcome. Bev, you've been here since the beginning. Thanks. I hope you didn't get too drunk. Were you guys playing a drinking game? Shoot me a Twitter or a DM or whatever, and let me know if you could, because you kept saying swabs and then a martini glass, and I figured you guys were playing a drinking game. And I've got to suspect that Chris Collins was involved with that too, and probably came up with the idea. Yeah. Okay. Well, I think we are up to real time. I'm just going to send out a chat message, which will go to everybody instantly. And Panda's up on the staircase recording me for her chat snap or something. Okay, yeah, Bev, you're drunk. All right, everybody. Maybe we'll do this tomorrow, maybe the next day. I don't know. We'll see what happens. They're probably going to do this tomorrow. And if anybody says anything nice about Trump, we're going to have one of these conferences and these rallies. And yeah, okay. Let's see. Stop streaming. Stop recording. Stop screaming. Stop screaming, everyone. I got nothing else.